Good morning, everybody. We're gonna get right into the content this morning because this is a long one. We was talking about over there at the Mrs. O. In that situation, I do want to put out a disclaimer. I went and made that poster for the Miss O because I thought it'd be cute. I knew it was an impromptu thing and whatnot, but I thought it'd be a nice gesture. You know what I'm saying? But we over here with this morning, we're gonna talk about Tennessee versus Karen and Michael Murray. Tennessee versus Karen and Michael Murray. Hold on just a minute, y'all. Sorry about that, y'all. Good morning, James. BNOA. Good morning, Miss Coffee. So what I'm going to do under the Copyright Disclaimer Act of Section 107 of the Copyright Act of 1976, allowance is made for fair use for purposes such as criticism, comment, news reporting, scholarship, and research. Fair use is permitted by copyright statute that might otherwise infringe. What we doing is we're going to go over this case, over this news. We're news reporting and telling you what's going on with this case. So I'm going to go over the synopsis first, right? Of what happened with this case. Um, let's see here. I have a lot pulled up, so I have to figure out. There we go. I'm going to start with this one first. Okay. This is the brother and sister, y'all. Okay. Two Johnson City siblings indicted and charged in their mother's death. Okay. Johnson City, Tennessee. The Washington County grand jury returned indictment charges on two Johnson City siblings with the murder of their mother on Thursday. In August of 2019, at the request of the 1st District Attorney General Ken Baldwin, TBI agents began investigating allegations of abuse and neglect involving 68-year-old Sheila June Murray after she was hospitalized and later died. During the course of the investigation, authorities determined that 39-year-old Michael Murray and 44-year-old Karen Murray, the victim's children, were responsible for the abuse and neglect that resulted in Sheila's death. Michael and Karen Murray were arrested and booked into the Washington County Jail Thursday on first-degree murder charges. Their bond has been set at $250,000. Then we're going to go over here. We're going to stop sharing that. We're going to share this tab instead. Tennessee versus Karen and Michael Murray, brother and sister murder trial. In Jonesboro, Tennessee, the two siblings convicted in their mother's death have each been sentenced to life in prison. In June, a Tennessee jury found Ken Murray and Michael Murray guilty on first-degree murder and aggravated neglect of a vulnerable adult in the death of their mother, 68-year-old Sheila Murray. For aggravated neglect of a vulnerable adult, the siblings each sentenced to an additional 8 years concurrent with the life sentences. The judge also gave them 3 more years to be merged with count 2. The brother and sister were scheduled to be sentenced on September the 30th. However, the hearing was canceled due to the aftermath of Hurricane Helena. A new date has not been set. Sheila died August 2019 after she was admitted to the hospital, prompting the Tennessee Bureau of Investigations to look into the circumstances of her death. Investigators said they determined that Karen and Michael were responsible for the abuse and neglect that resulted in her death. Karen and Michael were indicted and arrested in March of 2021. The indictment, reviewed by Court TV, does not specify any acts of neglect or abuse, but alleges that they occurred between April the 4th of 2019 and August the 10th of 2019. Okay, so we're going to go down to day 1 of the trial. Assistant Deputy A.G. Robin Ray made the opening statement for the prosecution, telling jurors many graphic details about the state of Murray's home, the oppressive heat inside, and the overwhelming scent of urine and feces, which only grew stronger as EMTs approached the bedroom in which Sheila Murray was found covered in fecal matter with an exposed tibia from a compound ankle fracture. Karen Murray's defense attorney, Chris Bird, argued that the state would not be able to prove the pair of siblings knowingly neglected Sheila and that Tony Murray and the defendants did not realize how far in over their head until it was too late. On trial day 2, Sonia Henry said that she believed her siblings were trying to care for their mother, but that they were in over their heads. We're going to watch these videos in here in just a moment. The jury heard a recorded interview between TBI Special Agent Brian Pritchard and defendant Karen Murray. Both sides rested. On trial day 4, the prosecution and defense delivered closing arguments. The jury deliberated for more than 2 hours before returning the verdict of guilty on all counts from Karen and Michael Murray. So we're going to watch right quick the doctor who shares the information on what the mother went through, and then we're going to watch the sister's testimony. And then once we get to these testimonies, I'm going to open the floor for everyone who wants to come up and say their piece. I also do have the contact information if you believe that these two were not given a fair trial for the Innocence Act. I have their information pulled up. We're going to drop that for people who may or may not think that these two individuals may not understand what happened to them. But it's up to you to decide. So I'm going to share this and we're going to watch it together.
State Defense ready to proceed with this video deposition for proof.
Yes, Your Honor.
All right. Yes. Dr. Lawson, I'll ask you to come to the podium and pause momentarily, and I'll swear you in, please. If you'll raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God?
Yes, Your Honor.
All right, I'll ask you to have a seat right there in the witness box. And Dr. Lawson, for purposes of presenting your testimony via the video deposition to the jury, I'll ask you to speak clearly and into the microphone. The videographer is a certified court reporter, and he will be preserving the deposition for purposes of submission to the jury during the trial.
Yes, Your Honor.
Would you state your first and last name for us, please?
Yes, my first name is Christy. My last name is Lawson.
Can you spell that, please?
CHRISTYLAWSON.
Thank you. General Ray is conducting the direct examination. You may ask.
Dr. Lawson, what is your occupation?
I'm a trauma, critical care, and acute care surgeon at Johnson City Medical Center.
And are you licensed in the state of Tennessee?
Yes, ma'am.
How long have you had a license in the state of Tennessee?
Since 2010.
Have you had any license in any other states prior to that?
I was briefly licensed in the state of North Carolina.
And when did you have that license?
It would have been in 2017.
And then was that dual license?
It was dual license, yes, ma'am.
And what medical school did you attend?
I went to the Medical College of Georgia in Augusta, Georgia.
And where did you intern?
I did my internship at the University of Tennessee in Knoxville.
And what did that internship consist of?
Internship for surgery residency is a year of rotations on general surgery services and rotations. It's a full year, calendar year, just broken up into different subspecialties. The remainder of my training was residency for 4 subsequent years.
And where was your residency?
My residency was also at the University of Tennessee Medical Center in Knoxville, Tennessee.
Okay. Since that time, where did you practice?
My first 6 years of practice remained at the University of Tennessee in Knoxville, and then I subsequently transferred my care here to Johnson City Medical Center. My start date was April 1st of 2018.
And has your nature of practice been the same the whole time that you've been with the Johnson City Medical Center?
Yes, ma'am. I was employed by Johnson City Medical Center to provide trauma, critical care, and emergency general surgery services.
Have you had the opportunity to do teaching?
Yes, I'm a professor of surgery at East Tennessee State University. I teach medical students and residents in the art and discipline of surgery.
And how long have you been doing that?
Since my career began in 2010, I've been an academic professor, or I've gone through the academic hierarchy teaching since I started practice in 2011.
Have you ever been published?
Many times.
And can you give us an example of some of the publications?
My most recent publication was a couple of months ago on ileus as a marker of critical illness and sepsis in trauma and critical care patients.
And what was the one before that, if you recall?
I did a case study on Bacteroides shoveni, which is a rare bacteria found in humans in farming accidents. And we had a presentation at Southeastern Surgical Congress in February of 2023 on that paper.
Here, at this time, we would as an expert in acute trauma and emergency general surgery services.
Any objection to that designation from defense? All right, without objection, Dr. Lawson will testify and is declared an expert in the field of treating patients with acute trauma and in general surgery as well. The jury will be instructed that her testimony is to be viewed as an expert in those particular fields.
Around August the 10th and 11th, did you have the occasion to see Sheila Murray professionally?
Yes, I was the attending surgeon on call when she presented, brought in by Emergency Medical Services to the Trauma Center at Johnson City Medical Center.
May I ask August 10 and 11?
Yes.
What year?
2019, sorry.
Sorry about that.
In my head, I said that. Can you describe her condition at the time that you saw her?
If you will give me a moment, I'm going to pull up my history and physical from that time in this packet. I was on call the evening of August the 10th of 2019. It was dated that we were notified the patient was arriving at 17:12. Reviewing the medical history in front of me because this was quite a few years ago, and I didn't remember until I reviewed the medical record. Once I reviewed the medical record, I have a very clear memory of Miss Murray. She arrived to the trauma bay by EMS transport, covered in feces and vomit. She had contractures and was unable to move her arms. She had a open fracture dislocation of her lower extremity.
I'm going to ask you to explain to the jury what contractures are.
Of course, contractures are where you have been lying immobile for a prolonged period of time with atrophy, which is wasting of skeletal muscle, and immobility, which makes the muscles draw up and the joints draw into the body, and it compresses against the chest wall or against other parts of the body, causing pressure. It's seen in stroke patients or in patients with prolonged immobility and malnutrition, in patients with cerebral palsy, anything that causes muscle spasticity and contracting that is not able to be moved by either passive or active range of motion, meaning we could not extend joints.
I'm sorry, if you'll continue with.
Yes, ma'am. She had an open fracture dislocation of her lower extremity with exposed bone. There was a significant amount of infection present there. She also had multiple wounds over a large portion of her body from these contractures related to pressure necrosis. There were wounds on her backside. There were wounds on her elbows and her feet. And there were wounds that I recall, a significant wound on her breast where it had been pulled up underneath her axilla on the right side, which is her armpit, where her arm had contracted down on top of it. And those pressure areas had caused the skin to die and the underlying soft tissue to die.
So if I understand that correctly, what you're saying is her right breast was up under her arm
That's correct.
and left in such a long time that the tissue had died.
That's correct.
And was there anything else that,
On our documentation, she was noted to have some aging processes in her eyes with cataracts present. She was noted to have severe muscle wasting, loss of subcutaneous fat, and signs and symptoms consistent with severe malnutrition and dehydration. She had wounds on her perineum, which is around where her vagina and labia are, also from pressure and laying in the same position for protracted amounts of time. And again, this fracture of her lower extremity was significant, and her foot was at a right angle to her ankle instead of in normal anatomical alignment.
and were photos taken of the injuries that you have noted?
Photos were taken after admission to the intensive care unit. I do not believe the photos were taken immediately in the trauma bay, as that's not usually our practice to do so.
And what would have been different about her appearance in the trauma bay versus ICU?
When she was admitted, she was clean, and all of her wounds were clean so that we could better appreciate the full surface area of the wounding. She was covered in feces, and we had to extensively clean that off of her body prior to taking these photos. Our nursing staff in the ICU spent a good long amount of time cleaning her before these photos were taken.
I'm going to ask the bailiff to hand you a set of photos. We're going to go through those individually, but I'm going to go ahead and hand you the whole packet.
Yes, ma'am.
The first photo in front of you, what is that a picture of?
This photo is a photo of her foot and ankle. It's difficult to fully appreciate in this photo because you can't see the remainder of her body, but her leg and her foot are not in normal anatomical alignment. And this area of black and open wound is her tibia, the end of her shin bone that comes out and usually is in normal alignment with your ankle to provide a place to walk.
And obviously I know it's not normal for that bone to be sticking out, but is it normal for it to be black?
No.
Also, okay. Why is that significant?
When a fracture is fresh and acute, you can see clean marrow edges. They're red, they're weeping, there's normal fluid that comes out of the body after an acute injury. It's part of the inflammatory process. Our body responds to acute injury by bringing in fluid to that area, sort of like if you think about pulling a muscle, there's swelling. This was an old injury, and you could tell that because there was no immediate swelling, there was no fluid, there was no weeping, there was no active bleeding, and the blackness at the end of the bone is indicative that the bone had been exposed to a dry environment for a protracted amount of time to the point that it was beginning to die.
Let me ask you, was Ms. Murray able to give you a verbal history?
No, ma'am. Miss Murray was documented in my history and physical as having a Glasgow Coma score of 9. And what that means is that she had spontaneous eye opening. So she was doing that on her own. She made incomprehensible sounds. All we could elicit from her when questioning her was a moan.
This case, Ray, is about a brother and sister who are charged with the basically medical neglect murder of their mother. But during this trial, we'll also see the defense really doesn't try to defend the defendants. I'm wondering if these brother and sisters, and this is the medical part where she had feces on her, she had bed sores, she like, here's a lot of thing that a lot of people don't know when you read over this case though. The father was alive when this went down. The father did not want to put her in a nursing home. He wanted her to go home, right? So the father chose to bring her home. All right. These two children are not children, they're grown people. They lived with the parents at this point. The mother died because of her, being bedbound. They said she was a pretty big woman. She had, a lot of extensive injuries, but all of it was based on neglect. I thought medical neglect wouldn't get you a murder charge per se, but maybe wrong. Not even 3 months after the mother passed, the father passed away. When this happened back in 2019, a lot of the things were put off, the trials, the sentencing, and all that, because of Hurricane Helena. So a lot of things, didn't take place right after she passed away. Even though this is 2024, it took them a while to get the evidence. And right now we're listening to the only two people that they have video evidence of being on the witness stand. So the only people that the defense didn't call anybody, nobody, they didn't evaluate this brother and sister to see if they may or may not be special needs. So I'm kind of looking at this in the perspective, is it horrible what happened to the mother? Yes. But I want to see throughout these videos as we watch, I'm paying close attention to the brother and sister, their actions, all this other stuff, because the defense really didn't defend these two. Now, do I believe they, possibly could be held responsible? Maybe, depending on the situation, because as I stated, the father is the one. But at the same time, you could play devil's advocate. I want to see what they do during the trial, because it's really sad that the defense team really didn't do much to defend these two at all. If anything, I would have had them evaluated all kind of things if I was a defense lawyer. But good morning, everybody coming in. Good morning, Pretty Big Woman Q, Ray, Soul Sister, Gemini Love, Red Hockey, Miss Tracy, King Kush. It's good seeing you, King Kush. I ain't seen you in a minute. Royal Court, Room Shaker, Shaker, Shaker. Good morning, y'all. Good morning. We're going to go back to listeners. And I may not listen in. The father was not charged because he passed away 3 months after the mother did. But, I don't know why they would allow him to make medical decisions for her if he couldn't physically take care of her. You get what I'm saying? That's the question for me. And also, even if you do bring somebody home, and I did that with my grandmother who had a massive stroke, right? But I had hospice care coming in, right? I had somebody that was sitting with her all the time, day and night. I had nurses in and out of there. I had people coming in and out every day. We had a house cleaner coming over. We had all those you can sign up for, a crap ton of stuff when someone is bedbound and or going through something like that. And I signed up for all the things. I had a nurse coming over, making sure her medications was right, checking her blood pressure, the CNA helping me come over and give her bed baths and things like that. And I set her up for everything. You know what I mean? Why not get her all the help that she can get? So in this situation, it's kind of unusual to me. We're going to watch part of this. I am probably going to not watch the whole thing. I don't know. Are y'all having problems with the sound on this one? because I sort of kind of am. I may end up just dropping the link to this one and letting people rewatch it in their own time because I'm having, like, it sounds really low to me. I do want to hear this sister's testimony, though. See, they had a sister who was outside of the home that got married and left, and she testifies. That's the one that I believe may or may not put the nail in their coffin, because medically wise, yes, was she malnutrition? Did she have fecal matter on her? She had bed sores, basically, is what they were stating. If y'all didn't hear some of those things they were talking about, she basically had bed sores, pressure point sores. And how I know this is because I had a special needs brother, right, who was almost 18 years old. That means he was bedbound for most of his life. And they just told you that the muscles were apatry, where basically their hands draw up to their body and their legs draw up, right? And that does happen with someone that is bedbound or someone who has cerebral palsy, which is what my brother had, part of his disorder. He had a bunch more disorders, but that was part of it, right? And so you do have to, when you have someone in that position, you can't leave them on the same side for a long time. You have to make sure, like, you put certain things under their body to keep, the pressure off of them. You have to change them around a lot. You have to get them up, put them in chair. Like, you just have to, there's so much that goes into taking care of someone who is bedbound, right? But you have to switch them around and all these things so they don't get pressure point sores. They don't get bed sores. It's very prevalent. Like, my brother never had a bed sore. And if we even noticed he was starting to get a pressure problem, we moved him right then. You know what I'm saying? Like, you got to make sure you stay on top of that when you have someone who is bedbound for most of their life, right? And my brother never had a bed sore, never had a pressure point sore, none of that. He wore diapers, obviously, for all of his life. So he never had, rashes, anything like that, because you got to keep them changed. There's so much that goes into it. But so we're going to watch this and see, what the doctor all states, because these are the only two witnesses they had for this entire case. And they played one recording, which is not in a video, I suppose, because I was going to play it too. And we're going to see what happens with this case. But that's the gist of it. Basically, these two brothers and sisters were accused. Basically, they wasn't just accused. They were sentenced and charged and all that other stuff in their mother's passing for murder. But there's a lot that goes, it's they only had 4 days of trial, y'all. And what I'm upset about is the fact that I don't think the brother and sister got the proper defense. But we're going to watch the rest of this, and then we're going to see what the sister states. Hey, Miss Sassy Francis, good morning, all y'all. We're going to play this, finish playing us, part of what this doctor says. Then we're going to switch over to the sister, because I think that's the one that y'all really should hear, in my opinion. But I do want people who do have medical know-how or knowledge to kind of hear what this doctor states, so you can make up your mind for yourself.
She was not speaking or articulating with words, and it indicates that she had posturing, a flexured posturing, and that's where when you give a stimulus, usually we will rub the sternum, sometimes we'll pinch the nipple or the earlobe to give a noxious or painful stimulus to the patient to see what their response is. A normal response would be to push your hand away to make that stop, and hers was a flexion posturing where she pulled in like this, but didn't push us away.
And as part of your treatment, is it a normal practice for you to go back and look at her prior history?
Yes.
And did you do that in this case?
It's a normal part of our practice to do so. We had looked back in the medical record and wrote that she had some past medical history consistent for a stroke, high blood pressure, a history of DVT, which stands for deep venous thrombosis, which is a clot in the lower extremity, that she has a clotting disorder called factor V Leiden, which is just an inherited clotting disorder that allows patients to be much more prone to blood clots. And I'm having trouble reading the photocopy, but it also said that she's been bedbound for years and had previously been in a nursing home. All that would have been obtained not only from the history that we found in the computer, which is an old electronic health record that we no longer use at Johnson City Medical Center, is not easy to access. So it's all printed documentation that you provided, and also from the emergency medical services who would have brought her in.
And so in this case, are you aware who provided additional information with regard to her health?
The emergency medical services personnel who brought her in provided the scene information and the transport information. They would have told us some of this history. It is pretty matter of routine that they would have asked family present at the time that they picked the patient up for any history that was pertinent.
Was there any information received that you reviewed with regard to the cause of the injury to her?
No, there was no one available for us to speak to with regards to the family, and we did not have any information about what happened to the patient to create the injury. EMS provided us the information that she reportedly fell several days prior to that at home, and that the family had called when they noted the wound, and that was all the information we were provided.
Your Honor, at this time, we would ask that the photo of the ankle be admitted as State's Exhibit 1.
All right, no objection. The photograph identified by Dr. Lawson depicting the ankle as she encountered it from Ms. Murray upon her admission to the hospital will be marked as Exhibit 1 to her deposition.
Can I ask you to look at that second photo?
Yes.
And what is it?
And if I may note, excuse me, that will be marked and moved into evidence for purposes of later
Yes.
submission to the jury.
This photo is, this is a post-operative photo after Ms. Murray would have gone to the operating room with our orthopedics team. This photo has, you can see in the top portion of the photo, an external fixation device. That is a device that we utilize to realign bone and put pins and stabilization devices into bones that are deemed to be too contaminated to put internal hardware. And so she has that. The tubing that's present in the picture would have been part of either this sequential compression device, which is designed to help prevent blood clots, or what's called a Provena, which is a vacuum-assisted wound management device that brings fluid and blood out of the wound to try to promote healing in a clean environment. We use that for contaminated wounds after orthopedic surgery. The remainder of the pictures, there's bruising on the top of the foot. There's these are chronic nail changes. This on the toe would have been one of the pressure wounds. And there's petechiae, which are just small pinpoint bleeds that could have been encountered during surgery with the attempt to reduce the fracture.
Your Honor, at this time, we would ask that that be marked as State's Exhibit 2 and moved into evidence.
All right, this photograph is after the surgery was performed on her ankle.
Yes, Your Honor.
All right, that will be Exhibit 2 without objection, marked and moved into evidence.
And in case I didn't get that in there, which ankle was that?
I'm gonna look back to make sure that I don't say incorrectly. It's the right ankle.
I'm going to ask you to look at the third photo.
Yes, ma'am.
And what is that a photo of?
This is a photo of a pressure wound, I believe of the elbow. If I can, it's hard to tell if it's the elbow or the heel, just based off of the zoom in.
I think if you flip it,
Then it's the heel. Sorry. It's of joint space. And so it's very common to see pressure ulcerations on joints. because there are areas of natural pressure where we will put naturally our elbow down or our heel down. And this being the heel, this would have been where the heel would have rested on a bed for a protracted amount of time.
And is there things that can be done to help with pressure wounds such as this type?
Pressure wounds are a very difficult problem in bedbound patients. They're known to happen when patients are immobile. Prevention strategies include offloading pressure, so keeping certain parts of the body elevated. For heel protection, we can put pads that are soft called Duoderm or Methylex on them, and they are available usually through home health agencies or durable medical equipment agencies to protect those surfaces that naturally rub. And then the mainstay of prevention of pressure ulcers is mobility, rotating and turning patients, which gets really difficult with prolonged immobility, and also proper nutrition. Without proper nutrition, pressure ulcerations happen and they do not heal.
And I moved that one into evidence. You still have the photo.
Yes,
Your Honor, I'd ask that be moved into as evidence of State's Exhibit 3.
All right. And without objection, let's see. That would be the left heel. The left heel, as described by Dr. Lawson in the photograph, will be marked as the Exhibit 3 moved into evidence.
I should look at photo number 4.
photo number 4.
Yes. And what is that picture of?
This is a picture I would presume to be her left foot, given that it looks very markedly different than the right foot. There is a pressure necrosis at the metatarsal head, which is the head of the toe joint of the 4th and 5th toe. And there's chronic nail changes, and you can't tell, but there's also a pressure wound underneath the digit of this toe, where you can see the skin edge peeling back. So there were multiple pressure wounds on this foot.
Your Honor, we'd ask that be moved as State's Exhibit 4.
And that was also the left foot.
Yes, Your Honor.
All right, that will be Exhibit 4, marked and moved into evidence.
And the next photo?
This is a photo of, I believe, her left leg, if I'm not mistaken. This is just indicative of chronic skin changes related to aging. There is a subcutaneous fat loss consistent with her diagnosis of malnutrition, and the dark is hemosiderin deposits. That's from peripheral venous stasis. This might have been the site of her DVT or her blood clot. I'm actually unsure, and it's not documented in my history which leg the DVT was in, but it is really common to see deposits of blood in the skin after a blood clot and prolonged immobility.
And in that photo, there's a line that goes down the middle of her leg. Is that of any significance?
Honestly, it could just be a fold in the skin from edema, from the sheets. It's difficult for me to tell if that was a true pressure wound or if it was just creasing in the skin, and I do not recall.
Your Honor, we'd ask that be moved as evidence as State's Exhibit 5. That would be the left leg.
Without objection from the defense counsel, the photograph described by Dr. Lawson of the leg and skin covering the leg of Sheila Murray will be marked, moved into evidence as Exhibit 5.
And wait a moment. Okay. And what is that photo?
This is a photo of Miss Murray. You can see her face in this photo, which is like a little more emotional. This photo shows the signs of severe malnutrition. She has, you can see rib margins of almost every rib in her chest wall. You can see the evidence that at one point she was a much larger woman. She's had a lot of stretching of her skin, and a lot of her subcutaneous fat is gone, and that has left just skin folds and redundant tissue from, at one point or another, large volume of subcutaneous fat deposits that are now gone. She has evidence of severe cachexia. Cachexia is when you lose skeletal muscle mass from wasting and malnutrition. You can also see in this tube, she has a nasoenteric tube that we place. That's the yellow tube going in her nose. It goes in her nose into her intestine to provide medications and nutrition. We would have placed that upon admission to the intensive care unit. This is her abdomen and its scaphoid, which means that it's indentated in, and that is just, again, a sign of malnutrition. And then the square is a blot out of her left breast and the wound on that breast.
Your Honor, at this time, we'd ask that be moved into evidence of state exhibit number 6.
Without objection, the photograph just described by Dr. Lawson depicting the face and upper body of Miss Sheila Murray as she saw them in the hospital. The Johnson City Medical Center will be marked as Exhibit 6 and moved into evidence. Is that correct?
The next photo.
This is a photo of Miss Murray's left elbow, again depicting pressure necrosis of a joint, which is a common place to see pressure necrosis. And then here on her skin fold over her left, would have been her rib cage, and the beginnings of her ptotic breast are some petechia, and that would have been where her arm was pressed up against that side of her chest wall from her contractures or her skeletal muscle tension.
Your Honor, we'd ask that photo of the left elbow injury be moved into evidence as states exhibit number 7.
All right, without objection, the elbow that's depicted with a blue glove and medical personnel is, thank you, is marked as Exhibit 7 and moved into evidence.
And the next photo.
This is a photo of Miss Murray's ear. The medical device is a oxygen saturation probe that we would have placed on her ear so that we could obtain an accurate saturation of how much oxygen was in her bloodstream. It looks as though this is blood from the external auditory meatus, which is the ear canal. There was some dried blood present at the time of admission, noted on my history and physical. And this would have been drainage from her ear, and there was a little bit of pressure necrosis of the earlobe as well.
Your Honor, we would ask that photo of the left ear be moved as states exhibit number 8.
Left ear, the left ear.
Yes, Your Honor.
All right, without objection, the photograph just described by Dr. Lawson of the left ear of Miss Sheila Murray will be marked and moved into evidence as Exhibit 8.
I'm going to ask you to look at the next 2 photos together.
Yes.
And what are those photos of?
These are photos of Miss Murray's right breast. This was the breast that was up underneath her right axilla, and it was pinioned underneath her armpit from the contracture of her right arm. The medical personnel who documented the history and physical on admission, it would have been one of my resident physicians. She documented that she felt the patient had had a mastectomy. And upon further evaluation of the patient, once we were able to clean her in the ICU and do a better exam, we found that she had not had a mastectomy, but that her breast had been up underneath her axilla for a prolonged period of time. And this is a picture of pressure necrosis of the nipple areola complex of the right breast.
Would this be something that would have happened over a day or two, or?
No, this would have happened over a period of weeks to months, most likely. This degree of necrosis, you can see there's already tissue death of the nipple itself, and there's fibrinous exudate, which is fibrin is a byproduct of wound healing. This wound had been going on for so long that it was attempting to heal itself and was unable to do so because of continued pressure. This is very commonly seen in advanced deep tissue injuries. We call them stage 4, which means that they have gone from a redness of the skin through the top several layers of skin and have involved not only the dermis and the deep dermis, but also the fat under the skin. And it's indicative of chronic and prolonged pressure changes.
And would that be something that would be treatable before it got to stage 4?
Removal of pressure is how you treat the beginnings of a pressure necrosis. Our practice is when we notice the beginnings of deep tissue injury, the first stage, stage 1, is indicated by redness of the skin. Once you start seeing those skin changes, if you do not offload pressure appropriately, then they will progress. So yes, they can be treated prior to the development of open necrotic wounds.
And if the pressure is removed, does that stop the pressure wound?
It tends to stop it from progressing. Does not necessarily mean that it will heal. Malnutrition contributes to lack of wound healing.
Here, we would ask that the next 2 photos be collectively Exhibit 9. If the full right breast photo would be 9A, and then the cropped of just the lower part of the breast, the nipple area with the infection would be 9B.
All right, exhibit 9A is the entire, you said it was the right breast?
Oh, yes, Ron.
That will be exhibit 9A. Thank you, ma'am. And exhibit 9B will be the closer version of the tip of the breast with depicting the infection as described by Dr. Lawson. That'll be 9B.
And the next photo.
So basically, as what we're hearing from the doctor that was there for her care, she had a lot of necrosis, right? Basically, she was bedbound. Her legs and arms were apatry, which basically means they were pulled up, right? You know, you ever seen someone who's had a massive stroke and they're bedbound, and their arms kind of pull up to their chest area? And their legs start like bending at a weird angle because they're not getting stretched as much as they should. So the ligaments in your body end up tensing. And that's what basically they're talking about, is how, you know, her breasts were under her arm, the pressure from her, you know, laying a specific way for a specific amount of time. It basically caused bed sores, and it caused them to be in stage 4, which is necrosis, which means that they have to debris every one of those and remove the dead tissue. This is what a lot of people don't know. This is the bad part of it. They have to debris those things to try to heal them. Sometimes it's best, if it's in the later stage and it's really terrible, to just try to give pain medication to the patient, because there is no healing a wound that's to the bone, right? You can try your very best, but that's the reason she passed away pretty much, was because she had a lot of, you know, she had a break to her ankle, and the bone had started to turn a different color because it wasn't a fresh wound. It was a very old wound. A lot of the, you know, pressure point problems happened over a period of time, from the skin pressing together, And if a lot of people don't know how to take care of a person who is bedbound, then you will have these issues. You can't just leave a person who is bedbound in one spot. It's not just changing the diaper. It's not just feeding them. It's not just trying to get them to eat when they don't want to eat. You've got to add in a bunch of other factors with it. Like you have to have chucks to put up under them. You have to have, there's these special little things that you put under their body that makes it a lot softer so that they don't get pressure point problems. Good morning, my beautiful, pretty chocolate girl, Mr. Beasley, Team BMF. Good morning, y'all coming in. So basically, we're going over this case of the brother and sister Erder trial. And here's my thing. They never tested this brother and sister that I know of to see if they are special needs. I semi-believe, in my opinion, that they are special needs. They're 30-something and 40-something years old living with their parents still. And by the looks of it, it's as if nobody had their best interest at heart to see if they even, like, the medical. We just heard a while ago that she was in a nursing home. And they signed her, the father did, who before he passed away, signed the mother out of the nursing home. Against doctors, orders, basically. What they recommended. With her having that severe stroke, she has all those medical conditions, to where she can get blood clots easy, which means that she could also bruise easier, which can cause pressure spots to get worse. And with her having a blood clot disorder, at any point in time, if you don't pay attention to every little thing on the body, she could get a blood clot, and it could cause like a whole limb to go bad. It could cause multiple other problems, right? Deep vein thrombosis is a very huge thing. So, for this situation, it kind of makes me question why they allowed her to go home in the first place and didn't have things set up before she went home. Like, if in case this was the case and she was already in a nursing facility, she would have went home on what they call hospice care. And at hospice care, they have nurses that come out to check. They have all these different things. So why wasn't any of the procedures that they usually follow in this kind of situation followed? Now, we are going to listen to the sister's testimony and whatnot, and then I'm going to open the floor. I also do have pulled up, if anybody wanted to see it, I can also drop it in the chat, the day they were sentenced and the day they were found guilty. They were basically sentenced to like life in prison. And this is I'm going to share this tab instead. To me, it's a very sad situation. I do not think this brother and sister were given the, hey, Red Wings, hey, Bees, hey, everybody. I'll just say, hey, everybody again. But, the Miss So, I saw you come in, girl. Sassy Francis. But yeah, so they were not, in my opinion, given a fair trial. I also think that they should have tested their mental faculties. This is going to be very sad if come to find out that these two are special needs people, right? And they were left to care for a person who was bedbound, and they didn't even know what they were doing. And then they got sentenced and they're in prison. I'm like, what if these grown adults had the mind of a child? Like, nobody even went in to look at their school records. Had they graduated high school? What was their IQ level? Even before you release a patient to home health, to home, that has these amount of health conditions, you should make sure the person that's trying to take care of them can actually take care of them. And in fact, I had to sign papers when my grandmother came home because I always promised her that she would never go to a nursing home, that if she was going to be that bad, I would try my very best to make sure she was home and that she passed away at home. And I did that. I kept that promise. But I had to sign paperwork and everything and, prove that I was able to care for a bedbound person. You know what I'm saying? You have to be able to take care of a bedbound person. So what if these two were special needs children, special needs adults, and, nobody tested them? They had no defense. That's what bothers me about this case. But I'm going to go ahead and play the sisters, and we're going to hear from her. So far, this is what bothers me. I haven't heard this yet, so I'm live reacting with y'all.
And can you spell that?
Sonyahenry.
And Miss Henry, you're sort of soft-spoken, so I'll ask you to pretend you're communicating with the folks in the far corner over here and our last juror over there next to the clock on the back row. We need to make sure everyone can hear you clearly.
Yes,
okay?
ma'am.
That's a perfect tone right there. I think everyone can hear you. If anyone has a hard time hearing Miss Henry or any other witness that testifies today, please let us know. Okay. All right. You may ask.
Thank you. Good morning, Miss Henry.
Good morning.
Do you live here in Washington County, Tennessee?
No, I do not.
Have you ever lived here?
Yes.
When did you live here?
All my childhood and until I went off to college in 94.
Do you still live here in the state of Tennessee?
Yes.
Okay, and who do you live with here in Tennessee?
My husband and my 3 children.
Did your family continue to live here in Washington County even after you left for school?
Yes.
Okay. Do you remember the address of where they lived?
Yes, ma'am.
And what was that?
1405 East Watauga Avenue.
And is that here in Washington County, Tennessee?
Yes.
Who all lived at 1405 Watauga Avenue?
My mom, my dad, my sister, and my brother.
What is your brother's name?
Michael Murray.
Do you see your brother here in the courtroom?
Yes, I do.
Can you point him out and describe something that he's wearing?
He's right there in the blue and white plaid shirt.
Your Honor, if the record could reflect identification of Mr. Murray by the witness.
The record will so reflect.
If you know, how long did your brother, Michael Murray, live with your parents in the house on Watauga?
He has lived there all his life.
Do you know if he ever had a job or worked outside the home?
Yes.
What kind of relationship did you have with your brother?
It was your typical one, but I think as I went off to college, we weren't really that close once I left home.
And you said you had a sister. What's your sister's name?
Karen Murray.
Do you see Karen Murray in the courtroom?
I do.
Can you point her out and describe something she's wearing?
She's right there with the black shirt.
Your Honor, if the record could reflect identification of Miss Karen Murray by the witness.
The record will so reflect.
If you know, how long did your sister Karen Murray live with your parents on Watauga?
She also lived there all her life.
Do you know if she ever had a job or worked outside the home?
Yes.
Yes, she did.
Mhm.
What kind of relationship do you have with your sister?
Typical one, and we remained closer as I left home.
You talked about living with your parents. What was your father's name?
We called him Tony. His name is Edwin Murray.
And has he passed away?
Yes, ma'am.
When did he pass?
He passed November 15th, 2019.
What kind of relationship did you have with your dad?
I had a good one. We were close.
And lastly, what was your mother's name?
Sheila Murray.
Now, of course, your mother's the reason that we're here today. And the jury has already heard some things about what happened and what was seen the day that your mom went to the hospital. But I want to go way back before that. Tell us about your mom.
She, big lady. She was happy. She was a very strict parent, but she was a good parent. She was very funny. She knew no stranger when we were out and about. She just liked to talk to people. And she was a great cook.
What was your favorite thing that she cooked?
Probably her fried chicken. She was pretty famous for it in the neighborhood. Extended family would come around just to get her cooking. So, yeah.
Can you replicate that fried chicken?
No, no, I can't. I tried.
You talked about other family members and people in the neighborhood. She was famous for that fried chicken. Did she have lots of friends and contact with the neighborhood, with her community?
She got along with the extended family. Yeah, she didn't have like a lot of friends. She stayed mostly home and just in the neighborhood. But yeah.
And what kind of person was she?
Outspoken, opinionated, but kind.
After you moved out of the area, you said you left to go to school and hadn't lived here since then. Did you come back and visit your mom and dad and your siblings?
I would come back, probably average every 2 or 3 months or so, just depends.
When you would come to visit, did you come alone or would your family come or both?
Both.
When you would come to visit, where would you stay?
I would usually stay at a hotel.
Was there a reason why you stayed at a hotel?
Yes, because they weren't very good at keeping house, and it was always, I don't know, unkempt, if you would.
Just cluttered, or was it dirty, or both?
Kind of both. Always lots of clutter.
Had it always been that way, or was it something that changed as your parents aged?
It had always been that way, but I think it probably got a little worse as they got older.
I want to direct your attention to 2015. Do you remember that year as the year that your mom, Sheila, had that first stroke?
Vaguely, yes.
Okay. Did you visit or see her after she had that stroke?
Hmm.
Can you tell us how she was affected? What you saw about maybe any changes in her after that stroke?
From what I can remember, she was less mobile. She was just a little slower, but still mostly herself.
So less mobile. Was she able to walk with assistance?
Yes,
What about talking? Was her
she could
speech?
talk. Yes, ma'am.
And in those early days, there in 2015, if you know, was she able to take care of herself in any way?
Pretty much, yes.
Did that change?
Not that I can remember.
Okay.
No.
At some point, well, let me back up. As far as her mobility, her talking, her self-care, did that get better?
No.
At some point, did she become more dependent on your family to take care of her?
Yes.
Did you know who took care of your mom?
It was mostly my dad. Yes.
Did your brother and sister do anything to help your mom?
I mean, yeah, they would try to do what they could around the house and things, but when she was still mostly able to take care of herself.
Once she got to the point she was more or less bedbound and needed help getting in and out of the bed, that type of thing, did your siblings step in to help more?
They did.
Did your dad have his own health issues?
Yes.
At the time that we're talking about, this time frame, was your dad still working or was he retired or both?
Both. He was retired, but he was still working part-time.
Do you remember where he worked?
I remember Securitas Security.
Okay.
I was doing that part-time.
And when he worked, do you know who was responsible for taking care of your mom?
It was still him, and he had asked my brother and sister to help.
Okay. So they helped. They also had a part in taking care of her.
Yes.
At any time, did you feel like your mom needed more care than she was getting at home?
Yes.
What made you feel that way?
Because I guess I felt that way because I knew that they probably couldn't give her the care that she needed to the extent that she needed it.
And what kind of care are we talking about?
Bathing, I guess, lifting, things like that. I knew that they could do it to a certain extent, but probably not to the extent that she would probably need.
Now, I know that you weren't living here in Washington County, but did you ever offer any assistance or to help in any way?
I did. I had a conversation with my father to help. My husband and I offered to help, even bring her to Chattanooga where we live, and he refused. He didn't want to do that.
Do you remember, I want to take you to 2019, the year that your mom passed. Did you visit with her that year?
Yes, I did.
Do you remember when you came to visit with your parents and your siblings?
I do, because I came in February. That's her birthday month. And I came up just briefly for the weekend to see her. And then I came back that July for Jonesboro Days so my kids could come see their papa.
Let's talk about when you came in February around her birthday. Did you see your mom then?
I did,
Were you staying in the house or in a hotel?
in a hotel.
Were you by yourself or did your kids come in February?
I came by myself.
How did your mom look to you in February of 2019?
Well, she looked how she normally looked when I came, which was never well. And usually when I would come, she was always, in the bed, covered up. So I would just see basically her face, neck area, and say hi. But at that point, she was nonverbal, so there was no speaking. But she would look at me, and that was the extent of it.
So she would look at you, so she would see that you were there.
Mhm.
Did she of course we understand that she looked unwell at this point, but did she look like she was being taken care of?
From what I understood, yes.
Did she look clean?
Well, yes, because I only saw from her head and her neck. So I just assumed she was getting taken care of.
So let's talk about when you went in July.
Mhm.
Was there any kind of difference between how she looked in July as how she looked in February?
It was about the same. From what I remember, it was about the same.
Okay. And how did she look? Was she in bed, in a chair? How was she when you saw her?
She was in bed again, just in her nightgown, what I could see on her shoulder, and looked the same.
And was she still able to look at you, track you when you were there, or was it a little bit different in July?
She could track me, but not as well. It took her a little longer from what I remember in July.
So let's talk about the day that your mom was taken to the hospital. How did you find out that your mom had been taken to the hospital?
I got a phone call. I think it was from my sister. Can't remember if it was my sister or my dad, who called to say that they had trouble getting her out of bed, and she had hit her foot. And so they took her in because they realized that it was worse than what they thought.
Did you have immediate concerns about your mom when you had that conversation with your family?
No, because of her condition, and she had been sick for so long. I was just like, okay, keep me posted since, you're taking her in and she's getting checked on. Just keep me posted. So no major concern.
Did they keep you posted on how she was doing?
They did.
At some point, did you feel like it was necessary for you to come into town?
Yes, I think it was the next day, from what I can remember, that I asked them to let me see her via the phone video call, and she just didn't. She looked worse, and they said, you probably want to come up, and so I came.
Okay. How did she look different on that video call than when you had last seen her?
Her face just looked, I can't fully describe it. She just looked worse.
Okay. Did you come into town?
I did.
Okay. And when you came into town, what did you do?
I went straight to the hospital to see her. She was in the ICU.
Did you talk to any of the doctors or nurses while you were there?
Yes, I remember a doctor coming in to talk to me when I was there.
When you saw her in person there in the ICU, what did you think about how she looked?
Well, again, all I could see was her head because they had her covered in a special bed with some sheets that were blowing. It was very dramatic and just different. And I could tell that she wasn't going to be with us longer.
Did you talk to anyone, or the doctor, about her injury to her leg that prompted the call to 911?
I asked about it, and I don't remember who the doctor was. I just remember it was a man, and he came in and he seemed very angry, which I found very disturbing. Not that he was angry, but just the way he was looking at me, I was uncomfortable. And he began to tell me that he thought that that what had happened to her wasn't matching up with what my family said.
Did you see her injury?
Briefly, he lifted it up. They had already set her foot. So yeah, I got to see it.
What did you think about it when you saw it?
It looked terrible. Terrible.
I know that at some point in this investigation, you had a phone conversation with Blake Ketron from Tennessee Bureau of Investigation. Do you recall that?
Mm-hmm.
And of course, in preparation for your testimony today, you had a conversation with General Ray and myself. Is that right?
Yes.
In the course of those conversations, you were given a little bit more information about the condition that your mom was in. Is that right?
Yes.
How she was found. Did you have any idea that things had gotten that bad with your mom?
I did not.
Did you ever have any indication that things were that bad from your dad or from your siblings?
No.
Your Honor, if I can have just one moment. If you recall, when you talked to Agent Ketron, he had asked you about the last time that you had seen your mother. Do you remember that?
Yes.
And when you spoke to him, you believed the last time you had seen your mom was in February. Is that right?
Yes.
When you were speaking with General Ray and myself, you mentioned that July visit. Was that something that you remembered later on, or why was there a reason?
It was, I think, because I was by myself for the February and birthday, and it was just kind of more of an emotional. I got to see her for a birthday, but then when July came, I guess I was more happy because I came up with my kids, and it was Jonesboro days, and again, I just saw her briefly, and the rest of the time we were just kind of hanging out, doing the Jonesboro days stuff.
Doing the tourist stuff.
Yeah.
Yeah. You told us that when you had found out that your mom had been taken to the hospital, that you were told what they thought had happened to her ankle, to her leg. At the time you got this information, Were you concerned that she was seriously hurt?
No,
Did you feel differently about that when you saw what her ankle looked like?
yes,
Did you feel like it was a little bit more serious than you initially had been told?
yes.
I'm sorry, Your Honor. From in the course, because we know this happened in 2019, so we've had 4.5 years since your mom passed. In the time since your mother passed away, have you had conversations with Michael or Karen?
Yes.
In your conversations with them, did they ever talk to you about what happened to your mom?
Yes. From what I can remember, my sister she just thought it was something that happened when they were trying to get her up out of the bed, that they accidentally bumped her foot getting her out. And she had no idea it was that serious.
When you were told about the condition that your mom was found in when EMS came into her room that day, you told us that that was the first time you had heard that. Is that right?
Mhm.
Had your brother or sister ever told you how bad it was?
No,
Had they ever told you about not cleaning her or changing her?
no.
I have no further questions. Your Honor.
Cross-examination. Mr. Byrd.
Ms. Henry, thank you for being here. We go back through some of the things you testified to here on direct. So I'm talking about your mom. It sounds like she was kind of the bedrock for your family. Is that fair to say?
Yes.
Now is it correct that she stayed at home and she ran the house while y'all were growing up? Is that
Yes.
right? Okay. What did your dad do for a living?
He was a police officer.
Okay. What did he do before that?
He was in the Navy.
Okay. When did he retire from the police? Do you remember?
I don't remember what year that was.
Okay. It'd been some time before the events we're talking about here.
Mhm.
Okay. And that home at 1405 East Watauga, that was where you grew up. That was the family home.
Yes.
Okay. You talked some about your father's health conditions as he was getting older. Do you remember what kind of health problems he had?
He had kidney issues. He had been on dialysis years before. He had heart issues. He had had a heart attack before.
Do you have anything like sciatica or any problems with his back or anything like that? If you remember.
Not that I'm aware of.
Okay, that's fine. You said your mom didn't get out a lot, didn't have, you said, a lot of, close friends or anything. It sounded like, is it fair to say that the home there was where she was most comfortable?
Yes.
Okay. How long are you the oldest child?
I'm the middle child.
Middle child. Okay. How long have they lived in that house since they got married, or do you know when they moved in there?
I mean, they got married and they used to live in Florida, like when we were babies.
Okay.
And I think they moved to Johnson City around 80.
Okay.
What I remember.
Somewhere in there.
Mhm.
Okay. But that was the only home that they had since they moved back to Tennessee. Is that
Yes.
right? Okay. Now, you said that usually when you came in, you would stay at a hotel. because the condition of the home, that was, I think you said it was unkempt. And that's just the way it always was. Is that right?
Yes,
Okay. All right. So there was nothing, nothing about it that you would see when you come in that was really out of the ordinary in terms of what you were used to seeing.
that's correct.
Okay. As your mom got older and started having these health problems, was your dad the one that would make the decisions for her in terms of what she was doing or
Yes, sir.
care she was getting? Okay. Was your mom on his insurance, or do you remember?
From what I know, yes.
So is it fair to characterize the situation there at home as that especially as your mom got her condition degraded, that your dad was pretty much the person in charge of the house and the decision making? Is that right?
Yes.
Okay. Was he a stubborn man?
Yes, he could be.
Could be.
Yes.
You said your mom was stern. I'm sure they bumped heads a few times over the years. So you said when you came to visit in February of 2019 that she, would you characterize her as looking kind of frail in appearance?
Mhm.
Okay. Was she having problems with eating by this point?
Yes.
Okay. What were the problems that she was having?
Just she would eat slower. She wasn't eating as much, and she would need some assistance.
Okay. Was she getting to a point where she was refusing to eat, or she was fighting when they tried to feed her, or do you know?
I assume not, but I'm not
Okay.
totally sure about that.
Okay. You said she didn't look well. Is that just was that sort of over the years, I guess, as her condition degraded, she just kind of looked more and more sickly? Is that fair to say?
That's fair to say.
Okay. And that she was covered up. Did your mother she had a blood clotting condition, didn't she?
Yes.
Okay. Was she apt to get cold a little easier?
Yes.
Okay. Did she stay covered up because of that? She'd usually keep a blanket on her or something?
Yes.
Okay. Now, when you visited in February 2019, you said by that point she had become nonverbal. How long had that been the case where she wasn't really talking anymore? If roughly, I know I'm not asking to the day, but
I would say it had been at least a few months
okay.
at that point.
Let me come right back to that point, because that actually gets me to something else I want to ask about. Now, do you recall something happening with her in early 2018 where she had to go to the hospital?
Yes.
Okay. What happened then?
I believe she had had a stroke, and I think she had also had some other blood clot issues.
Okay. Do you remember if she had pneumonia or anything like that?
I can't fully remember.
Okay. But your dad, your siblings, they took her to the hospital on that occasion?
Yes.
Okay. Then when she was released, she went to a nursing home. Is that correct?
Yes.
Okay. Now, when she was at this point, whenever she was in this nursing home, was she still verbal? She was still able to talk?
Yes.
Okay. This would have put us probably late January, early February 2018, just for context about what we're talking about. I'd say, does that sound about right?
Sure. Yes.
Okay. All right. Now, you talked some about the conversations you had with your dad about possibly bringing your mom down to Chattanooga, or where exactly near Chattanooga do you live? So
I live in the suburb Ooltewah.
Ooltewah. Okay. Now, I want to keep calling it Chattanooga if it's not. So, but whenever when this time when she was in Cornerstone and she was getting out, was there a conversation? Was that when one of the conversations happened about you bringing her to your house, or do you remember?
It could have, I'm not completely sure.
Okay.
It might have been one of the times we had that conversation.
Been 6 years, so it's, I think you can be excused for not remembering exactly. Do you remember was there any conversation about putting her in a nursing home or something long term at that point?
Yes.
Okay, and why wasn't she put in a nursing home at that point?
From what I can remember, he he wanted to be able to take care of her at the house. They felt like they could provide that care.
Okay.
Um,
This was your dad?
this was my father.
Okay.
Yes. And he felt that he could do that with the help of my brother and sister.
Okay. Was there any financial worries about being able to afford putting her in a nursing home?
Yes, because he couldn't afford the care. I can't remember how much it was, but I just remember he couldn't afford it. And so he was like, well, we'll make do and we'll keep her here and take care of her.
Okay. Do you believe that, were you comfortable with that decision for them to take her back home and take care of her at that point?
I was not completely comfortable with that, no. But it was not up to me.
Okay.
But I made my opinion known.
Okay.
But no,
So that was your dad made that call.
my dad made that call.
Okay. What made you uncomfortable with taking her home like that?
Because I knew that she needed some superior care, and I knew that they could probably care for her, but not to the extent that she would need.
Your dad and your siblings, know that they, best of your knowledge, they didn't have any kind of medical training or medical knowledge or anything like that, did they?
No,
Okay. Is that kind of what your concern was? You thought this was more than they were capable of handling?
yes,
Okay. Now, for a while, did it seem like they were doing okay?
yes,
All right. When you'd come to visit and you'd see your mom, I mean, initially when she was still verbal, she's still ambulatory to a degree. Did it seem like they were getting by?
yes,
Okay. You feel like they were, I guess, for lack of a better term, doing the best that they could.
yes,
Okay. Now you said that sometime before this February 2019 visit, she'd become nonverbal. So her condition had continued to degrade. Is that correct?
yes.
Okay. Was she bedridden by the time of February you came? Or was she pretty well confined to the bed at that point?
Yes.
All right. Do you know if they had any problems? I don't know if you recall this, but do you know if they had any problems with getting her to roll over on one side, or if she would fight them about that? Do you remember anything about that?
I do not know.
Okay. Were there any pets in the home?
No, not that I'm aware of.
You know, if your sister had any cats or anything?
She had cats. I just knew they were outside. At least when I came to visit, they were always outside on the porch.
Okay. You know if they ever came in?
I do not know.
Okay. I'm jumping around a little bit, but I want to ask about after the events that happened with your mother, did you go over to the house
Yes.
in August 2019?
Yes.
Okay. Did you go in and look around?
Yes.
Okay. Did the house seem out of the ordinary in terms of appearance of what it normally was?
No.
Okay. Do you remember telling Agent Ketron when you talked to him about the house smelling like cat urine?
I remember it just smelled like urine because I do know that they would have, I guess you would say, accidents changing her. So it wasn't surprising to me that it smelled like urine
Okay.
back in the room that she was in.
The
Carpet.
that one of the issues that plagued your mother was over the years was she developed incontinence. Is that correct?
Yes.
Okay. That was. Had you ever had in the times that you came to visit, that you had to assist with getting her changed and doing all those things?
No.
Okay. Do you know how often in a given, I don't know if you have any idea or not, if you had any given day, how often that she would have accidents or things like this would happen? I don't know if you have any idea.
I don't have any idea.
Okay. Now you talked about coming back to visit in July of 2019 and that she looked, for what you were able to see, that she looked pretty much the same as she had before, right?
Yes.
Okay. Do you know, had she developed any problems with, a lot of times with strokes, people have one side of the body that's more affected than the other. Do you know if she had one side that was more affected? Did she have left side, right side problems?
trying to remember. I mean, she was always covered up, so I don't think I remember any one side. She just was always just laying there.
Okay. Was there anything in July 2019 different about your mom that from February other than what you talked about there that you can remember? She seemed about the same.
About the same, just a little slower tracking me.
Did you become more concerned about their ability to take care of her? Is she degraded more?
I think at that point, I still wasn't sure
Yeah.
what the level of care they were giving her. I just assumed she was getting taken care of, best that they could do.
Did you feel like your family? Let me ask this first, and it may seem like a silly question, but you believe your dad loved your mom, right?
Yes.
Okay. How long were they married at the time they passed?
Can't do the math, but over 45 years.
Okay.
Mhm.
Long time to be together.
Mhm.
Your siblings, you believe they loved your mom too? Okay. Do you believe even feeling that way about their mom did you feel at that time that they were in over their head in terms of what needed to be done for your mom versus what they could do?
I think so, yes.
Okay. Did that feeling grow as you saw her get worse and worse, become nonverbal, become bedridden, all this? Did that feeling grow that you thought, hey, this is out of your league?
I don't know if I'd say it would grew because I'd kind of already made that known to them. So it's just kind of the same.
Okay. You had a lot of reservation to begin with.
Mhm.
Didn't go away, certainly.
Mhm.
Okay. Did you have particular concerns with your siblings? Anything about, let's say, with Karen? Is there anything about Karen that caused you concern in terms of her ability to be able to help take care of your mom?
I mean, not really, outside of maybe not being strong enough to lift her, I guess, but
Okay.
otherwise, no.
You said your dad wasn't really strong enough to, at that point, with his problems, he wasn't really strong enough to lift her either. Is that
Correct.
right? What about with Michael? Is there any concerns with him?
I knew he would be strong enough to lift. So that's why I was like, okay, they're going to be able to at least give her some basic care.
Okay. Any other concerns about him being able to assist?
Not really, no.
Okay. Do you remember, in speaking with Agent Ketron, saying that, you had made a statement that your siblings, that they could barely take care of themselves? Remember saying that?
Yeah.
Okay. What did you mean by that?
Well, just because they were always just, in my opinion, a little more immature.
Okay.
And so it was probably enough for them to take care of themselves. So that's why I had reservations, because even though I knew that they could do their best, it wasn't going to be to the level it should have been.
Okay. And as you said, they both stayed there with your parents their whole lives. Is that right?
Yes.
Okay. Do you believe they were, in your assessment of this situation, that they were maybe naive about the situation?
Yes.
Okay. Maybe didn't know what they didn't know?
Yes.
Okay. All right. All right. Jump in the situation in August 2019. I guess afterwards, because you the conversation you had with your siblings about what had happened to your mom, did that happen? Do you remember when that happened, proximity wise? I mean, was it at the time? Was it a couple months later? Do you remember when?
Are you referring to the injury?
Yeah, that's what I'm talking about. Whenever you said, let me clarify a little bit. When you said that they'd said something about that they might have hit her foot on the bed or something like that, do you remember when that conversation took place?
It was at the time.
At the time, okay. They said they weren't sure. They thought that's what could have happened.
Mhm.
Okay. Did your mom did she have any kind of history with like falling out of the bed?
Can remember back when she was in the nursing home that she had fallen because they had to put the rails up.
Okay.
So I know it at least it happened once or twice during that time.
Do you know after she came home if she fell out any?
Not that I was made aware of, no.
All right. Do you think when you were told about the injuries, you were told about what had happened, and you characterized on direct, you'd said that you weren't made aware how serious it was that you saw when you got up there. Did you feel like that spoke maybe to the naivete or the lack of awareness of how serious things were, that like you saw it and you recognized this and did you feel like they were trying to cover it up?
No, I just felt like they were probably just in over their head. They were trying their best, and that's all I know. They were trying their best.
That they didn't understand how bad it really was?
Apparently not.
Okay. Is there anything that leads you to believe that your dad or your siblings would have, if they'd known about her being in that condition for some time, that they would have just let her lay there like that? Do you think they would have done that to her?
No.
Okay. So is it fair to say that whatever happened with her ankle, and as bad as it was, and we've all seen the pictures of it by this point, it was bad. As bad as it was, you don't believe that if they'd known that was a condition, that if they had known that beforehand, that they would have let her lay there like that?
I don't believe they would have. No.
Okay. I'm jumping back a little bit on this question I meant to ask you earlier, that February visit. By then, do you remember, I may ask you a version of this already, but was her appetite staying the same or was it decreasing? Do you remember?
I don't fully remember, but I feel like it was decreasing.
Okay.
Because I do remember helping to ship some insures to the house. And so.
Do you remember if she had any problem with swallowing?
Not that I remember. No.
Not to remember. Okay. Like I said, it's been 5-6 years since a lot of this stuff. So, okay. If you don't care to give me just one moment, please. Just a couple more questions. Do you, during this time when after your mom left Cornerstone and she came back home, was your dad the only one in the home working? Best as you remember?
Best that I remember, yes.
Okay. All right. So the financial situation didn't really change over that time, stayed pretty much where it was at.
Yes.
Okay. Now, actually, when you were trying to get your mom down to Ottawa with you, I never can say that word right. Of course, couldn't be Red Bank or something. It had to be something I can't pronounce. But whenever you were when you were trying to get her down there, was there any reason expressed for why he insisted on her staying home?
From what I remember, he got very stubborn. He kind of almost got a little upset and was like he could take care of her.
Okay.
Because that was his wife. He could take care of her.
Ottawa is a very nice place. I've been there before. It's very nice. All right, Ms. Henry, I believe that's all the questions I have for you. Thank you.
Redirect. Oh, Mr. Dawson, did you have questions? I'm sorry.
No, I do not.
Yes.
Redirect.
Ms. Henry, you said that back in 2018, when there was the discussion about your mom staying at home or going into a nursing home or care facility, that your dad felt like he, with the help of your brother and sister, could take care of her at home.
Yes.
Is that right?
Yes.
And you said that you had concerns
Yes.
and you expressed those, but you got, I guess, outvoted.
Yes.
Did to your memory, if you know, did your brother and sister ever object to being part of that plan to take care of her at home?
No, not that I remember. No.
Now, although you had some concerns about her going home in the shape she was in, did you have any concerns that your dad, your sister, or your brother whether they would feed her?
No.
Did you have any concerns about whether or not they would give her water to drink
No.
or her insure?
No.
Did you have any concerns about whether or not they would bathe her?
No.
Now, we know at some point, as your mom's health continued to decline, she did become incontinent. Did you know that she was wearing diapers?
Yes.
Did you have any concerns that your brother or sister wouldn't change her diaper?
No.
You mentioned that when you were asked about the smell and the urine smell, you said that you knew that there had been some accidents while they were changing her. Is that right?
Yes.
Did you have any concern that they wouldn't clean up after her
No.
or clean her after she had an accident?
No.
When you went to the house back in August of 2019, you went to the house after she had passed. Is that right?
Yes.
When you went into the room, had that room been cleaned up, the bed stripped down?
I don't remember. I think so, but I'm not sure. Not sure.
When you talked to Agent Ketron, if you told him that it had been cleaned up, stripped down, would that be correct?
Yes.
Okay. You told us that you assumed that she was getting taken care of by your dad and your sister and your brother, but you did feel like they were in over their heads, right?
Yes.
Did you told them that, right?
Yes.
Told your dad and your brother and sister. But they assured you they had it in hand.
Yes.
You were asked about falls, about your mom having some falls. Is that right?
Sure. Yes.
And you remember, Mr. Bird asked you about that. And you said you remembered being told that she had had some falls at the nursing home. And so they had put the rails up on her bed.
Mhm.
But you hadn't been told of any falls in the home.
Correct.
Is that right? You said that you know that they were trying their best. Is that right?
Yes.
And you said that you did not, when you were asked about the injury to her ankle, you were asked if you thought they would just let her lay there hurt like that. And you said, no, I don't think they would have just let her lay there with that ankle. Is that right?
Correct.
Would you have expected that they would leave her in her room for hours on end without checking on her?
No.
Would you expect that they would let her lay for hours on end in a dirty diaper?
No.
Would you have expected that they would have let her lay in her own urine?
No.
Let her lay in her own urine so long that it dried and crystallized?
No.
Would you have expected that they would have let her lay in her own feces
No.
and let her lay there so long that that feces began to mold?
No.
You said that your dad believed that he could take care of her, that he wanted to take care of her. But his plan of taking care of her was taking care of her with the help of your brother and sister. Is that right?
Yes.
You said as far as concerns, your only concern about your sister Karen taking care of your mom was her strength. Is that right?
Yes.
And as far as your brother, you had no concerns and you felt like he had the strength to lift her or move her, whatever was needed. Is that right?
Yes.
In the courtroom today, you pointed out your brother to us. Does he look a little bit different now than he did almost 5 years ago?
Completely different. Yes.
How does he look different?
Well, because he was at least 3 times bigger.
So he was like you mentioned, your mom was a big woman. He was a big guy.
Yes.
And you would describe him as strong?
Yes.
After your dad passed in November of 2019, what happened to the house on Watauga?
The two of them remained there, and it just seemed like they didn't care to take care of it. It just kind of got dirtier, if you will.
But they lived there, just the two of them?
Mhm.
Do you know if they ate food, drank water while they were there?
I assume so. Yes.
So they took care of themselves on their own without your parents.
Yes.
You told us that in terms of your siblings, that you were closer to Karen than you were to Michael. Is that fair?
Yes.
And through the years after your mother's illness, did you continue to talk to Karen on the phone?
Yes.
Did she talk to you about taking care of mom?
I mean, it would be very brief. I would always ask, how mom was doing, and she'd be like, she's doing okay, or, she's she only drank today or she ate this today, but nothing for me to be concerned about.
If she had told you, Sonia, I can't do this anymore, I need help, what would you have done?
I would have helped more. I would have stepped in and helped more.
And I know that we've talked about that your dad was a guy that could be stubborn. He could put his foot down, right?
Yes,
If your sister or your brother had told you this is getting to be too much, would you have stood up to your dad and stood with your siblings?
I would have, yes.
But that didn't happen. They didn't come to you that way.
Correct.
I have no further questions, Your Honor.
Reed Cross. Mr. Byrd.
Ms. Henry, now the discussion on coming home from Cornerstone presented to you as though it was some sort of democratic election, but that's not really the way the hierarchy worked in that house, was it?
No,
It wouldn't matter if what Karen and Michael would have said. If your dad wanted it to be a certain way, that's the way it was going to be. Is that correct?
pretty much, yes.
Okay. So whether they opposed it or what they felt about it, when he decided your mom was coming home, that was what was going to happen, right?
Yes.
Okay. Do you feel like your dad had he felt, I think you testified some to this already, but he felt a duty to your mom to try to take care of her?
Yes.
Okay. Financial issues aside, that's his wife. He wanted to try to take care of her the best he could, right?
Yes.
Was that kind of feeling, was that something that was instilled in you all as kids?
Yes.
Okay. You feel like your brother and sister learned that from your parents?
Yes.
Okay. Did y'all get taught, as far as your siblings voicing any sort of concern about this, that they were, if your father thought that he was doing his duty, trying to take care of your mom the best that he could, that your siblings were felt like they were doing their duty also?
Yes.
Okay. Whether they're over their head or not, that's one thing. They can be completely over their head, but they're doing what dad wants and what's been instilled in you all to try to do. Right. I don't know if we need we're going to let the record reflect that she'd responded in the affirmative. I don't know if it picked
Yes,
up.
that
If
was
you would
correct.
give an audible response, you're being
That's
recorded.
fine.
Yes, ma'am.
Thank you. Say yes or no is appropriate.
It's a natural thing to do. Now, you said sometimes you talk to your sister about your mom, and that sometimes she'd say things like, well, she only drank today, or things like that. So were there times that they tried to get her to eat and drink and that she wouldn't?
I would assume that could have happened, yes. But I know, as I'd stated earlier, I would send in insurers. So that was kind of like the backup, that she would
Okay.
drink those.
All right. But you said you have three children, is that correct?
Yes.
Okay. You're down there having your life, having 3 kids, and trying to keep up with that. You're trying to run your life. So, you've got enough to keep up with as it is. As far as like the day in, day out there in the house, unless other than the days you came to visit, there's no way for you to really know what was going on, how things were happening there. Is that fair?
That's fair.
Okay. And that's not your fault. Like I said, you're off trying to raise your family, trying to do your thing. You got enough to worry about. But along those lines, in terms of day in, day out difficulties that your siblings or your dad may have had in your mother's care, it would have been hard for you to know about those, wouldn't it?
Correct.
And you don't know if, other than these conversations that you might have had with Karen or when you came in, you don't know if they did voice concerns about that as time went on. Is that fair?
That's fair.
Okay. So there was only about maybe a little over a month between You know, Jonesboro Day is always around July 4th. You came back to spend probably about the second week of August. So it's a little over a month between that last visit and when you came back for what we're here for. Is that right?
Correct.
Okay. Do you remember in your visits in, I guess, February or July, do you remember there, I think you said this earlier, that there being a smell of like urine or something like that that you could pick up from where she'd have these accidents in the house?
Yes.
Okay. So that wasn't just, you know, out of the blue. If you walked in and you smelled that, that was something that you kind of came to
Correct.
expect.
It was not surprising.
Okay. Do you know if your mother stayed in a hospital bed? Is that right?
Yes.
Okay. I think you had told Agent Ketron that the bed appeared to be soiled when you went back in August of 2019. But did you ever examine the mattress in February or July or any time before that? Did you ever see it?
No.
Okay. So you couldn't really talk to what the condition of it was then, if it was anywhere near the same or anything. Wouldn't be
No.
any way to know, right? Okay. Do you remember your mother having any problems with her feet?
Yes, that she had kind of had feet issues kind of all her life from what I can
Okay.
remember. Yes. Swelling
Okay.
and such.
So she'd have swelling like around her feet, around her ankles, around.
Feet and ankles.
Okay.
Yes.
Was that with that have to go with her, like that clotting disorder that she had? Do you know if that was some?
I mean, from what I can remember, that could have been part of it. And then just in summers, her feet would swell.
Okay.
Just remember from
Summers.
childhood. Yes.
Like August of the year, being in the summertime, that her feet would swell when it got hotter.
Sure.
Okay. Was it hot in the house when you went to look at in August? Do you remember it being hot in there?
I don't remember.
Okay. Did they keep it warm in there?
It felt room temperature from what I can remember. Yeah.
Okay. Do you remember in talking to your dad, him ever complaining about, you know, the cost of medical bills or insurance or anything like that as it came to like your mother's care? Do you remember him ever complaining about those things?
Just initial conversation, he was just complaining about how much it was going to cost to put her in a nursing home. And that's why he didn't want to do that. That's all I can really remember him being
Okay.
frustrated about.
Do you remember whether or not the house was going to have to be put up? Some kind of
Yes, I
collateral?
remember that. Yes. And he didn't want to do that.
Okay. So that was going to have to be collateral to put her in a nursing home?
Yes.
Okay. In talking to Agent Ketron, I meant to ask you about this earlier. You'd made some comments about your brother and sister having some kind of mental issues. What did you? We go one by one. I mean, what did you with Michael, for example? What did you mean by that?
Well, I knew that he had some mental issues mentioned. I know from conversation my sister and I had. He had went and had some evaluations. Thank you.
See, right here, I don't think they want them to know about them two having mental conditions because it would hurt their case. So I'm sitting here looking at this like, yeah, those kids had mental conditions. I'm telling you, Jay Dizzle. The minute she said, yep, I think they should have had those two evaluated and had their conditions on, on display, because it does show to
The
the
objection
responsibility.
is sustained, and the question will be stricken, and the response of the witness will not be considered by the jury.
You're away from the microphone, so it was hard to hear me when you said that.
I'm sorry. All right, the last question will be ignored by the jury, and the response of the witness will not be considered as evidence in this case and not referenced during your deliberations.
Knew that your father or your siblings would do something to hurt your mother if they knew better.
Correct.
Nothing further.
Okay, right quick before I drop the, link for people to come up and discuss, I am going to show y'all something. I went, obviously we all know I'm nosy. This is the house in question. It is not up for sale right now. But this is the house in question that they just stated the address for legally. This red house right here. So that is the house that they lived in. It was in a city setting. They had neighbors next door, as you can see. Also, I found the father. This is the father right here, Mr. E.A. Tony. If you scroll down, you'll see that there was somebody here says, "I'm so upset for your beautiful children who tried to help you do right by your wife and their mother. People don't seem to understand how much men want and need their wives like boys need a mom. That you passed shortly after is a true confirmation that you had no ill intent in keeping her close and trying to be her protector to the end while staying the provider as well, not losing your home to take care for your love. You had the best intentions, and I hate how this ended. I hope you and your wife are able to rest in peace with the faith that this injustice be overcome soon." And there is a crap ton, when I say a crap ton, of outpouring of his community for this man. Mr. Murray was a special person who loved his family, especially his grandchildren. We had many conversations about our grandchildren, especially the teens. We shared some of the same thoughts about the youth of today. With a kind smile and a soft tone, he'd say, "They'll be okay. We just have to keep loving them." I'm going to miss his frequent trips to Chattanooga. God bless you and may you rest in peace. He was a police officer. There's a lot of officers under this page, sending their condolences. The minister, from the Thankful Baptist Church. And so it just the condolences. And I don't know if some of these, most of these, what I'm reading are coming from the time of his passing, 2019, when he passed. But, yeah, so he was a very loved person within the community, but also I'm going to share this. If you think that these two were the injustice for them was terrible, this is the Innocence Project. You can contact them at info@innocenceproject.org or press@innocenceproject.org. Their website is innocenceproject.org. So you can actually bring up cases here and see the cases that they're working on and all those things. But I'm going to stop screen share. That is literally also, I forgot to screen share this right before. Let me present y'all with this right quick. You know that care home they were talking about putting her in? Okay, we're fixing to show some of the things that is where this one's at. It's called Cornerstone Village. Okay. Now it has a rating of 2 by this website. Okay. It's a Christian home for aged Inc. at Sherwood Drive in Johnson City, Tennessee. The quality rating is a 4-star. The health inspection rating is a 1-star. The staff inspection is a 3-star. Sustained complaints, 2. Facility reported incidents, 2. Number of fines, 1. Number of penalties, 1. Also, if we go down here, they tell you some of the statistics and things like that. They do have 1 freedom from abuse and neglected exploitation thing, 1 quality of life and care, which means these are deficiencies. These are reports against them, right? They had 3 against resident assessment and care planning, and 2 for pharmacy service. So they've had some complaints. They've also had, that's the health deficiencies. They've had 7 of those since their inspection, and they have 5 deficiencies in fire. They're not emergency prepared, construction deficiencies, smoke deficiencies ×2, gas and vacuum electrical systems. So these are deficiencies. These inspections are by the health and the fire people. So by the health department standards, they've had 1 abuse, neglect, or exploitation problem, 1 quality of life and care problem. These are deficiencies that so far they've gotten, and that's not all. And also, these are the different things in the area for Johnsonville, and a lot of them are 2-star. So maybe they don't have the best. Now I'm going to stop screen sharing. Maybe they don't have the best when it comes to care facilities in the area. Maybe he didn't feel like it was a good enough place for his wife. Also, I do know for a fact that nursing homes will make you sign over property if you it's like an insurance plan. So the insurance will pay, if they have insurance, for a percentage of the care. You're responsible for the other half. If you do not pay the other half, then they will come and take the property. So if he did own his home, and let's say he got behind on a payment, they would then put his home in foreclosure, take it from him, and sell it. And maybe he was afraid of taking this from his children, right? From his kids. Maybe he was afraid to, that if this happened and after his passing, his children who were special needs would not have a place to go, right? Because he paid for the family home, he knew even after he passed that they would at least always have a roof over their head, if nothing else, right? If nothing else, they would have a roof over their head. In some of the testimony that we heard, she said that the house was always dirty, even from the time before her mom got down, right? Oh, we got us a guest, y'all. I got to make sure I put my banner up, y'all. Let me put my basket. Oh, child, it's trying to do something weird.
Good morning, boo.
Good morning, girl. We was talking about this case. This case was sad, child. It was sad.
What? Oh, Lord, not somebody doing something out here. Child, I saw you was live. I just left ODS and I said, I am actually awake while Charlie is live. So I needed to pop up and say, hey, boo. Hey, everybody. Jadine, Catherine, pretty chocolate girl.
You was up late last night, child. I saw that.
Yes. Well, listen, after a while, I popped down. I was like, yeah, we're not getting nowhere with here. So it's time for me to go. It's time
I've
for me
been
to
asleep on the loud.
Good morning, James. That's what, and I knew it. You know what? Like Odell said, when you start feeling tired, you start getting just bounce. I was like, I'm out.
I ain't staying. I'll tell y'all. I'm like, bye.
Yeah, sure does. Bye.
I'll hit that X so fast. I accidentally did it the other day, and I didn't mean to over there at Mrs. Zintel's when Brooke had a question for me. I was just saying bye, and I clicked off, and about that time I heard, I got a question for, I was like, dang, I'm sorry.
It happens when it happens. It is what it is, child. It is what it is. So now tell me about this trial right quick so I can go ahead and go to the store and get my vanilla and stuff, the little stuff that I missed. I knew I was going to forget something.
We always do, don't we? Around Thanksgiving time, we always begin something. Basically in this trial, it's a brother and sister who are on trial for the murder of their mother, but
Oh,
they didn't absolutely like go in and hurt her or nothing like that. She was bedbound, right?
okay.
And they, the quality of care that they gave her was not good enough, and she basically passed away from it.
Oh, wow.
But their father was the main caregiver.
Oh, okay.
He passed away 3 months after she did. So
Oh,
they
wow.
wasn't able to charge him, obviously, if he's passed away.
True.
They said that, the two kids, the sister did try, they asked, and they got it struck from the record. I just played that. Did your brother and sister have any, mental problems? And she goes, yes. He went, and when she started saying that, they objected, got it thrown out. The
Wow.
problem that I think the defense had, and the reason I don't think this is right,
Mm-hmm.
they didn't have them two tested for their IQ
Okay.
score or anything that was wrong with them, because these people were 30 and 40 years old, still living at home, barely being able to hold jobs.
Oh, wow.
Yeah, you could
See,
kind of tell that they wasn't
all the way there.
all the way there. Yeah. And so, they were just doing what their father wanted them to do.
Oh my gosh. It's one, caregiving is hard. Is extremely hard, and you have to know what you're doing. Luckily for me, because of my own body and what I know about myself, I can give her more personalized care because I know how she feels. And this way, but now if something like this coming, you got to try to find anything and everything that might have helped in the cause of the mama passing. So yes, I would have had my IQ tested. Yes, I would have had a psychiatrist just completely test my whole thing. Is she depressive? Is she this? Is she that? Is she capable? Was she capable of doing it? Both her
The
and him.
mother, the mother was completely bedbound, and basically what ended up happening is she ended up having one of her ankles, like she fell out of bed and one of her ankles got broken. Well, they didn't realize how bad it was because her ankles always swelled anyway, so they didn't pay attention. They didn't, obviously, if they found dried on poo on her and pee, they didn't change her enough.
Oh,
That's
my
one thing. Now
gosh.
I could see him getting a neglect charge,
Yeah.
possibly, but not for murder. No, and not for life sentences.
Whoa. So
yeah,
they
they got
going for that. I can see manslaughter.
they got life sentences. Not just something little. No, they got life sentences plus one count for 10 years and another count for 30 years or something like that on top of
Damn.
that. So
Good
they
morning,
are
Latoya.
never getting out.
Damn. That's they need some better lawyers. They definitely need better lawyers. That's a lot. Auto counts like that. I mean, that to me suggests that the mother not just had like bed sores or something, more like
She had
organ failure and all of
she
that.
had her health conditions. She had bed sores, pressure spots, necrosis because of that, because her body was atrophy, which means that the muscles
Right.
don't move,
Yeah.
and she was pretty much bedbound. And like the sister said, she thinks they got in over their head. They
Yeah.
didn't realize what it was to take care of a person that is completely bedbound. That she had a massive stroke, and
Okay.
so she was like, she couldn't talk that good. She was okay for a little while talking afterward, but she got to a point, how it does, that she wasn't able to speak as well. She could talk a little bit, but with aging and strokes, and she had a disorder to where her blood clotted more than normal.
Oh, wow.
So she had, like, I'm gonna say it like this: why they didn't in that area, and this is where I think the health system failed them.
Yeah.
Why they didn't set up hospice care, because it seems to me that that's basically what it should have been. They couldn't tell you whether she was going to be here 6 months, a year, 2 years, 3 years, but pretty much, that's end of life care.
Yeah.
You could pretty much tell when someone's bedbound to that degree and with that many health issues, it is end of life.
When that gets to that degree, I say you have to let the real medical folks step in. You got to do the whole, putting someone in a home that really can have that 24-hour care. I mean, you can
That's
do only
what
so much.
That's what the sister was fighting for. But the reason the father didn't do it is, he had regular insurance from his job, from work.
Yeah.
And it would not cover it. And they were trying to get them to sign over the house as collateral. And he didn't want to do that. And so he was upset about the cost and everything else. So he's like, you know what? That's my wife. I love her. I'll take care of her until her last day. And I don't think they understood the severity of what it takes to take care of a person that is bedbound 24/7.
That is something that I can't even fathom trying to do. It takes a lot. I mean, we're talking about helping them through physical therapy, helping them eat, helping them. I mean, you're there with them 24/7 in their face constantly, calibrating their medications. And that's why I love my mom's doctor, because it's a whole facility for geriatric care.
Well, see, my grandmother had a massive stroke like that. And she was bedbound but God didn't make her suffer that long. Let me say it that way.
Yeah.
It was within 2 months of the massive stroke that we lost her. And 1 month she was in the hospital, 1 month she was home. So I got everything together. At that time she had a PEP tube. So they were talking about she would have to go into a facility. So I was trying to find her the best one. Then they told me if she passed her swallow test that she could come home. Well, I told my grandmother that. I said, Grandma, if you want to come home and you want me to try to bring you home, I said, you need to pass this swallow test, because if you don't, they're going to stick another tube up your nose and you're not going to be able to come home because they're not going to let me. And sure enough, she followed that. She passed the swallow test, and we put her on the hospice care, and we had the nurses coming out to the house, the CNAs to help out, all those people. I had somebody sitting. She had a roommate at the time before she had the stroke, and he wanted to remain there. And I said, well, if you're going to remain here, do realize that when I'm not here, that will be the way that basically you pay me rent.
Yeah.
He's to help me out. You know what I'm saying?
It's expensive.
And so he agreed to it, and I let him even stay there after my grandmother passed rent free because of that, until he started tearing up the house. And then we had that's a whole nother story. But for over a year after she passed, I let him live there.
That was so kind. That's a blessing.
Because he helped me with her, so I felt like, you know what I'm saying? And so I had someone sitting with her 24/7 when I wasn't able to be there. But I was there every single day, 2 or 3 or 4 or 5 times a day, hours at a time, making sure she was changed, making sure that, she was switched around, that she didn't get no bed sores, and she got none of those things because she was taken care of. And yes, I do know Ensure. I had to give my grandmother Ensure. That is a meal supplement plan for someone who may not be able to eat solid foods.
That stuff is expensive. And I mean, after surgery, when I saw how expensive it was, I was like, oh, whoa, come on now. We talking a 6-pack for $12? Like, I mean,
and I was buying cases, girl. I was buying cases for my grandma. And she liked the chocolate ones above the vanilla ones. So,
strawberry. Give me
and strawberry.
Strawberry, and they got the caramel. Give me something, because now when they had me when I had the surgery for the cancer and the removal of the lymph nodes on my right side, they had me on the feeding tube when I was in the hospital, and I couldn't wait to get it out. I could not wait to get it out. It was just uncomfortable. So I can tell that your grandma's she wanted to go home. She was like, let me swallow for them so I can go home.
Out her feeding tube.
See?
She did not want that thing. And that's when they said they were going to try for the swallow test. And if she passed it, then she could come home. If not, then, she would have to go to a facility because obviously you cannot come home when you have a feeding tube. They will
That's
not
true.
allow you with certain medical equipments. They will not allow the person to go home. So obviously she didn't have any medical equipment that would cause it to wear certain medical equipment that would cause
Right.
it to where she couldn't come home. They did release her to her husband. You know, I don't think these two kids deserved a murder
No.
sentence. I do believe, however, they could have got with, you know, a neglect charge, but even then, depending on the state of their mental, if they weren't even able to take care of themselves,
Mm-hmm.
how are they going to take care of her? That was their father's job.
Yeah.
Even though he was older, that was his job. That he was the caregiver. They were not. They were just there.
So they never signed over power of attorney. It never
Mm-mm.
got signed over. So really, they couldn't do nothing but surf, like, because they couldn't get like the most out of the system. Because when you go into the living facilities, you put them in there. That's like their whole insurance pays for it, and then whatever checks or anything that they get, that goes straight to them. And I didn't like when my mom was in that living, you know, that in that facility for the month after she had her heart attack. I hated it because I saw the way that they, you know, kind of brushed off, you know, oh, what you need, okay. And it was like, are you serious? We paying $300 a day and this is what she gets? No, I can do better than that at home. So
I
that's
felt
why I
the
brought her
same.
home.
When my grandmother went into a couple of care facilities before she ever had the stroke, just for medication, you know how they'll recalibrate medications in there,
Yeah.
and so they have to stay for like a month or 2 weeks or whatever. Because she would do this point to where my grandmother she was hard headed, so I couldn't tell her nothing,
Of
and
course.
she would either not take her medications, take too much medications that were not hers, or different things like that. And so she would have to be. There was one time she literally cussed us out, child. I mean,
Oh
she
my
went
gosh.
off on my daddy and me. Child, she was in the hospital seeing demons.
Yeah,
Okay.
okay, yeah.
And so they checked her into a place. We didn't have a choice, right? They
Right.
took, you know how the state can take if they think the person needs it. They took
Yeah.
it and they checked her into a place and said, you're going to be there for a month or so many ever. It was however long to get her medication recalibrated
Right.
because she had enough alcohol in her system.
What?
She should not be here anymore, they said.
Okay.
She was sneaking liquor.
Yeah, that was my mother-in-law. There was bottles behind the pillows on the couch, under the couch. She was staying with us. It was way too much. She was doing the most.
My grandmother was hard-headed and she drove all the way up until she had the stroke. You know, so she was independent living all those years.
Right.
And so, you know, we couldn't say or do anything to make her do something. She was a grown woman.
Yeah.
And when she got checked in the hospital time, I thought something was bad wrong. I was crying, thinking I was losing my grandma. I was like, you know, I was broken.
I know. You know how we do.
Yeah. And then come to find out it was because she was drinking too much liquor. And so they had to put her in, you know, rehabilitation to get her medication straight and clean her out of the liquor.
Yeah.
And, you know, let her go through what they call, you know, DTs and all that while in a care facility so she wouldn't, you know, have any issues. And girl, she cussed us from one side to the other. Y'all done check me in this place. And I was like, we didn't check you in the place. And then her doctor finally, she went back to her doctor and her doctor said, no, I was the one that checked you in this place. She had to eat crow and apologize.
No, my mama still, they had to call the security in the hospital because she thought she was leaving. She kept saying, I want my mama. And they finally figured out that she was talking about me because I look like her mama so much. I guess the ghetto ratchet version of her mom.
The
And-
ghetto ratchet.
yeah, my grandmother was very, very much in her church. And I'm the ghetto ratchet version of her. I never heard my grandmother cuss, nothing like that. She had a sharp tongue, but she did not curse or anything. She's kind of like the deaconess with D Ham. This is why I love the deaconess, because it's like listening to my grandma. My grandma had a sharp tongue, and she'd make you think she cussed you out when she didn't. So I had to, I watched her take care of, and she had bad legs from a car accident, but she took care of her mother. And the way the brownstone was set up, it was like the 3 bedrooms were right next to each other. And there was like just doors right in between them, but it was like no hallways in between them. It was just one main hallway beside all of them. And she had my granny in one room. She had my granddaddy in the room with her, and then she had his brother in another room, and she was taking care of all of them at the same time. And she did that for like 10 years. And I just always admired that. And it made me realize that she said, you always take care of family. And this is why I know my role now is to take care of my mom. But when it gets to a point where I can no longer physically, then I'm going to have to do something different. And I dread that day. I pray it doesn't come, but life be lifing.
I will tell you one thing. If it
Mhm.
ever, there is something you can look into if she has insurance.
Mhm.
They do have like CNAs that will come out and help you. They do have people that will come out and sit with her while you go to the grocery store.
Mhm.
They have
Yep.
all these,
Respite care.
yes, they have all these programs for home health that are
Mhm.
super amazing. If it wasn't for those people when my grandmother was down, child, I wouldn't have made it.
Yeah, and definitely her insurance does have it. So if I really feel the need, like it's too much for me physically, then I will definitely do that. I don't mind. Never thought that I would be the one bathing somebody, and like that, a grown person. But I will do anything for that woman that I can do, because that was that woman. That's the same woman that at 15 she told a scared, pregnant teenager, it's going to be all right. I'm right here with you. And I will never forget that. And she has been by my side through each of them kids coming out. And she's been living with me for over 20 years now. Because I went on ahead, and you know how they don't like to give up their independence. But I literally just had to step in and take charge. Like, okay, the car goes back wherever it came from. They can take it. They can say and put whatever they want on the credit. We're not driving no more, okay? Because you're going 10 miles an hour on the highway. So no, you scared to go over bridges on the interstate. No, we don't need you driving, getting in an accident. I made sure to take over the medication. She's one of them people, Charlie, that you sit there, you hear her doing this. And it's Tylenol, and she's popping Tylenol all day long. And I was like, oh no, you can't do
Tylenol's
that.
not good for you. It actually builds
Exactly.
up on your liver. It is
Mm-hmm.
so, like, taking it every once in a while is okay, but what a lot of
Yes.
people don't know, it takes longer for your body to process Tylenol. So it
Yes.
actually builds up on your liver and can cause liver dysfunction. Trust me, I know. My doctors tell me about it all the
Exactly.
time.
Yeah, I mean that acetaminophen ain't no joke. So I took everything, and I didn't. I tried to do it in a way that didn't make her feel like I was just stepping in and pulling everything from her. I put her meds in little cups, and she knows that she takes one of these cups in the morning. I got it written right on the side of it, and then the other cup I give her in the evening when she eats dinner, because I don't want to mess anything up. I need to make sure I have her go every couple of weeks and get her INR checked, the rate of her blood flow, to make sure that she's not clotting, to make sure that it's not too much, so that you cut something and you just be bleeding forever. So I try to stay on top of it. And now adding YouTube into it, but see, YouTube I've been doing for a while, and for me, it's an outlet. It's
It
straight
helps you
possible.
when you think about it. A lot of these people don't understand like your point of view of what you're going through right now, right? I
Mm-hmm.
do because I've been there and done that. And when you're in a caregiver role, it is very isolating
Yes,
because you have so much responsibility that you're not going out there and hanging out with friends or doing all these other things. You're taking care of your responsibility.
exactly. Exactly. And that's what caused me when we went to Vegas kind of gave
Break
me even more
yourself.
anxiety.
Break
Break
yourself
yourself.
full.
Break yourself, fool. How you
Right,
doing?
look, she put the banner up like she was scared to open the door. Break yourself.
Break yourself full.
How you doing today, Jay?
Doing all right. You?
I'm good. Happy Thanksgiving to you and
Happy
Charlie.
Thanksgiving.
Yeah, I know you cooking. I know you cooking, even if it's just a little bit. I know that you cooking because you got that Instapot and you make me want to buy one so bad.
Girl, and that's the thing. I do have my Instapot, but I still don't have anything to cook yet. Because I don't know if I want to do seafood or if I want to I'm not sure. But I know I don't want nothing traditional.
Right,
Mm-mm.
right.
Yeah, but that's one thing. If I do get in the mood for traditional, I got a few people around me that have it, but that's just not what the taste that I have right now.
Yeah,
So, 9 times out of 10, I might just do some seafood because I ain't did it in a minute.
that ain't a
Or at
bad
least
idea.
not seafood that I went and bought. Went
Hmm.
out and bought.
That's not a bad idea because you use a little guru with the seafood up in there. I be watching you a little guru up in there with the seafood. Official Lovejoy,
Oh
she
yeah.
doing the seafood boil instead of the traditional Thanksgiving stuff. And I wanted to do something simple, but my mama with her age, and we don't know if we're gonna be here tomorrow. I just did not want to. I want to give her remnants of Thanksgiving past or Christmas past. This is why I pull up this stupid Christmas tree every year because I could really do without it. I do not need a tree in the room.
Girl, I got a tree, and believe it or not, I ain't put this tree up in about 6 or 7 years.
See, you don't need it.
But that's only because I downsized.
Okay,
Before I moved here, I was in the 3 bedroom. Now I'm in
okay.
the 2 bedroom. And I just didn't feel like, you know, putting it up and trying to move stuff around. And this year I've been toying with the idea. So we'll see if I actually get it done.
That'd be cool. That'd be real cool. I hope they
Well,
don't
yeah,
do another
because
Christmas
now
tree challenge.
Zulu ain't never seen a Christmas tree, but that's only because I
Uh-uh.
don't had him for the last 2 years.
Yeah.
But now KJ used to enjoy the Christmas tree. That's why I used to always put it up. But
Okay.
once KJ died, then I just stopped putting it up.
Right, right. Well, maybe Zulu will like it. I mean, I'm sure he's gonna be apprehensive, but
Right.
put a few treats around it, and he'll definitely be like, "Hey, wait a minute, this ain't so bad. It's food by
Well, now I just like for them to react to the lights because I put that lights on the jumping. You know how them lights be
Yes,
jumping around?
yes.
Girl, they be
Look,
running at it, barking, and then
he,
run back. Don't know what it is, scared of it because it's too tall.
he gonna be
That be
like, "What
funny.
is this?" I can see that now. That's gonna be too funny. CJ like the reaction. She she like the reaction.
Zulu gonna go off when he first sees it.
And he's gonna be like,
Right.
"What is this thing? And why are there lights everywhere? What is going on?" He may avoid that room altogether. He may be like, "Mm-mm, no."
I could
Well,
see.
and see, that was the thing that I was thinking because he got his vet appointment coming up, but I'm doing a drop off. And I said, probably that morning when I drop off, that's gonna be the time for me to put it up. So when he bring his little ass back up in here, it's gonna be up. So that's what I'm thinking about.
Oh my goodness!
If
Why
you
you
do,
gotta
I gotta see a
traumatize him?
video. I have to see a video of his
Please,
reaction.
please, please. Good morning, Andrea BMF. Good morning. That would be so cute. I mean, if you started doing shorts of just Zulu, that would be so cute because he is a much beloved pet of the YouTube sector, of the beef sector.
I know
Oh,
I
well,
will miss
thank you.
Zulu.
Well,
I
that's what I'm
will.
thinking about doing. So we gonna see about that. I just been pretty much scoping out where to put it up. But
Mhm.
this case right here that Charlie is talking about, it happened in Tennessee, and that's why I'm like, where in the hell is Demon Soul? Because this over here up in her stomping grounds.
Oh,
She done
She got
left
to be
us,
careful.
child.
she done left it. She said it's over. It's above me. It's above me. But that's so wild, though. I mean, just to think that you can get time like that because you're not caregiving as well as you should. But it's like you almost need a book, but you don't even get a book when you're raising kids. So what can you do?
What bothers me about this case, and me and Jay Dizzle have said this, I don't think these two individuals were in enough good headspace to even take care of their mom. It was absolutely their dad who was the one that said, no, we're bringing her home. You know what I'm saying? I got my two kids to help me and blah, blah, blah. He was the responsible party in this. But because he passed away 2 or 3 months after her, right, they could not charge him. So they charged the kids. And to me, it's like way too much of a charge.
Yeah.
If they were going to get anything, this is way too much. Like, you're talking about life. They got sentenced to life in prison plus 10 years for one count. And I think
Jesus.
there was another count that they got added on. So basically, they're going to spend the rest of their life in here. And it was even stated that before the mother got down, the house wasn't always kept up. And it got worse after she got down, obviously, because she was the main one taking care of everything. And
Mhm.
these two grown kids didn't know how to clean up after themselves. They didn't really hold jobs like they should. It comes into factor of how much of that is from their mental problems, and nobody evaluated these two.
And
They
it's too
did not.
late now, or can they appeal at least?
They can appeal, but I don't know if they're going to, because
Because
they
that
have
take
public
money.
defenders. They can't afford
Yeah.
representation, and that's what really sucks about it is, you know, when we talk about someone who may or may not have mental disabilities, right,
Hmm.
or different abilities, then it comes into question how much of it was on them really.
Mm.
And it's really saddening.
It is. That's sad.
Well,
How?
but this is how I know that they had piss poor defense attorneys.
Yeah.
Because the main thing that I took away from it, first off, that the brother was 39 when this happened, and this happened in 2019. The brother was 39, the sister was 43 or 44. They just get into their trial this year.
Damn.
As a defense attorney, I would have argued about their mental, because how in the hell do you get to that age and you've not socialized, you've not had kids yourself, you ain't had a family yourself, you haven't gone out and worked a real job?
What?
I mean, all of that. They worked outside of the home, but I think it might have been part-time, like it wasn't a real for real
Real
job.
kind of career. Yeah.
Right. And that right there is the telltale sign that they are incapable of doing it. So that's
Yeah.
the reason why the parents prefer for them to stay at home while they 45 and 39 years old.
That's sad. Now, a quick question: how long was the mother in their care? Was it like a year? Was it like a few months?
I don't know when her stroke happened initially. But I do know it was roughly about a year, I think.
Okay.
Because she passed away in 2019. But they were still able to be free. I don't think they got arrested. Well, maybe that's something you could look up, Charlie. See when they got arrested. Because I don't think they got arrested until like 2021.
Yeah.
And that's why I'm just like, y'all looking for something to do at them about this,
Yeah.
when the medical people should be responsible, not them. And
Sure.
the fact that the mama and the daddy both died in 2019, but y'all didn't arrest them until 2021. What was y'all looking for to put a case on them?
Somebody was pushing it from the other side. That's what that was. Somebody was pushing it from the other side. Somebody was, the prosecutors maybe have been looking to maybe show off a little bit. They'll put the littlest thing on somebody just to make an example. That's just, it's just they need it. Like you said, they got bad piss poor defense, and they need it better.
Yeah, but that's the reason why a public defender. Because if they had to get a public defender, then that explains why nobody helped. But again, these are two adults who have lived at home with their parents their entire life. So it ain't like they got a pension or a 401k or something to dip in.
True.
No.
True.
So all they could do is a public defender because both of the parents done passed away. So I mean, who gonna help them? And the reason why I said that they stayed there for 2 years because when the sister was doing this testimony that Charlie replayed, she said that after the parents died, her brother and sister stayed in the house, but she said the house got dirtier and they were not taking care of it or maintaining it. And
Jeez.
if I'm not mistaken, she said 2 years later, because then the person asked, well, were they eating? Did they eat? Did they take care of themselves? She said yes, but they weren't taking care of the house.
They were indicted in March of 2021.
Jeez.
So they waited
So
for trial.
almost 2 years. Two
Yeah.
years after the parents died, then they got arrested for this mess. And then they had to sit in jail to wait till 2024 to finally get their trial.
Good Jesus.
Also, it is stated that with the brother and sister thing, they had to wait for their sentencing from it took them like from, let's see, what day was it? Because I looked at this. Their sentencing was supposed to go down on September the 30th, and it didn't because of Hurricane Helena. And on this it says a new date has not been set, but obviously we know that it has been set because we saw their sentencing. They got this was the exact sentencing. They got first-degree murder charge and aggravated neglect of a vulnerable adult in the death of their mother, and they got the siblings each were sentenced to an additional 8 years concurrent with the life sentences. The judge also gave them 3 more years to be merged with count 2.
Dang.
Now, concurrent means, and I thought it meant separate, which is a different thing.
No.
That means together. So those 2 sentences technically don't mean anything because of life.
Mhm.
So they have life in prison, but it does not say if they have the possibility for parole or not. But even then, that's what, 40 years, 30 years?
Yeah.
And they're already in their 30s or something. So the time they would get out, they would be 70 or 80 years
No,
old.
now they both in their 40s.
40s.
Back
So
then,
yeah.
one was in the 30s. Now, if I'm not mistaken, now the brother, even though at the time he was 39, now he is 43. And then at the time, the sister was 44, and now she is 49.
Damn.
It said that Michael was 40 on the indictment and Karen is 45 on the day of the indictment. So the day they got charged, he was respectively
Right, but
40
that
and
was
she 45.
2021.
Yep. So they're older than that now. So they're closer to 50 now. So they're gonna be they might as well say they're gonna be the rest of their lives in jail.
Well, so did they do a whole jury trial, or they couldn't plea deal?
No, they took a whole jury trial.
Damn.
And it only lasted for 4 days. The defense did nothing really. They cross-examined the sister, and that was about it. He did have a moment to where one of the defense attorneys, and the other one never asked any questions, I guess because he just let the one attorney handle it. But where they were asking the sister if the brother and sister had mental problems. And she said, well, yes, I know that Michael, and then she was going to talk about the sister Karen too. But before she could finish her sentence, there was an objection and they struck it from the record and did not allow it go into evidence.
What? That is something that's so weird. I mean, really, you got people out here literally doing stuff to hurt people, and they don't get no time like that, and they would be able to plea bargain it. And you telling me that they couldn't even plea bargain?
But they don't even know what a plea is, though. That's how I feel.
Yeah.
They don't know what a plea is. But and then read that murder charge again, Charlie. What did it say? Just read that one charge.
Okay. They got first degree murder and aggravated neglect of a vulnerable adult.
Damn.
Right, but them two look like they vulnerable adults. So how you gonna
Exactly.
hold two vulnerable adults responsible for the care and upkeep of another vulnerable adult?
It
You could
makes no sense.
you could tell by looking at them that they didn't bathe like they should. You saw the older woman who is in her 40s, and her hair and the way she was dressed was that of a child.
Oh my God.
Like, let me screen share again to show you a picture of what they both look like when they went in to jail. Let me make sure I pull up a good one here so you
I
can see
can't
well.
believe it wasn't any leniency for them. I mean, because that just sounds really, really like set up almost. Am I right? Or I mean, that's like, is there no leniency? Okay, they look like they not completely there. So why and how in the world could they be okay?
But see now, Charlie, I never saw this picture before. This dude was a big dude. He
Yeah.
is a
Yes.
shell of himself now. Oh my
He-
goodness.
Wow.
He is so skinny now. The images of him now, after being in jail for 2 years, he looks like skin and bones.
Wow.
Like the when they showed him in court, which I did show that. Let me go and see if I can if they have like a picture. I don't yeah, there they go. Let me see. I'm gonna share the screen, but I'm not gonna click on it.
Yeah.
If you see where it shows the court TV right here,
Wow.
that's what he looks like now, and that's what she looks like now.
That's ridiculous.
Now she didn't change too much. She lost some weight. If you notice, her face is not as full. But from looking at him to him, he does not look like the same man
Not
whatsoever.
at all. That's crazy. That's just absolutely. Ooh, jail life has not been kind to him at all.
No, I just had to show that to show, like, if you were looking at it, right, and
Mhm.
you're absolutely looking at what they like. You notice he wasn't taking care of his skin.
Yeah.
What grown woman wears that hairdo like that? Not
Sure.
many, and not to the point that looks like a kid does it, like what
Yeah.
a kid does. Now, a grown woman might wear puffies, but she's gonna do some things to it, make it look
That's
cute.
true. That's true.
You know, she's not gonna go over here looking like that.
That is true. I don't understand how they could not tell
They
that they were
also-
not all the way there.
they grew up like this. Here's another thing: them not cleaning house and doing things was kind of taught. If you listen to what the sister stated, she said that even before her mother got down, the house would be a little unkempt, and that they would have like kind of like they were hoarders in a way, like they would have stuff
Yeah.
just all over the place. So the kids didn't contribute anything their entire life. They were spoiled in a way because they
Yeah.
probably were special needs. And so they continued that. She said after the mother and the father passed away, the house went into total disrepair. Like they didn't clean and that shows right there. That's not all the way just laziness. There is
No.
also something mentally going on there. Those two adults should have been put in a care home.
So them too. Then that's where medical comes in, and if you can't afford it, if they can't afford it, or medical doesn't deem them enough.
And that sister
What
pissed me
issue?
off, Jay Dunn. She did. She's like, well, I saw mom in like July, but then I saw her in February, and she just looked okay, and everything was fine, and it was.
So wait a minute. So
hunky-dory.
they had another sister. So there
They
was
had
the
a
other
sister who was well mannered, well spoken. I just played her testimony.
Oh,
She has
okay.
The
3 kids of her
sister, you
own.
missed that.
Yeah.
The sister graduated and left the house and went to college in 1994, and she never looked back.
And never came back. Yep.
She got married. She had 3 kids, and she moved outside of the county of where her mom and them was, and
Mm.
she left them with the brother and sister who could not take care, and she left the mama with the daddy who had his own health issues, and she only came and visited 2 times, maybe 3 times a year. And she saw everything that was going on, but she never did try to help.
Mm.
Even in her testimony, she said, well, if they would have told her that they couldn't handle it, then she would have did more. Girl,
See,
can't your
that's
eyes see that they
no,
can't
but see,
handle it?
that's like my sister when she comes down here and she's here for her 20 minutes and she's telling my mom all this stuff about Trump, about this, about that stuff that I mean, you ain't asked her how she feeling, what's going on with your health, what you need, what can I do? It's that 20, 25 minutes and then she bounced. So you drove all these miles, all these through all these cities and states to sit here for 20 minutes and say, hey, I'm like, really? And gave Charlie, gave her a wig, Jay Dunn, gave her a wig, a long blackish wig like Elvira with a headband on it. And I'm like, is this heifer for real? What
That's
did she
But
do?
not only that, with
the
that
father.
testimony that they the older
Oh, that's
sister
the
did,
father.
yeah, but he passed away too. But
Mm.
that
3
even
months.
from the testimony that she said, Charlie, I'm sure that you heard her say that when she went and visited in February and in July of 2029, she stayed in a hotel
See?
because the house was too unkept for her to stay in. Well, if you notice that you don't want to lay your head up in here, why would you go in the hotel and leave your mama laying her head there?
Exactly.
Why didn't she help them occasionally? Like I mean, she may not have been able to be there every single day, kind
What
of
about set up a
situation.
maid
But
situation once a week?
and she had a husband and she's working, so both of them have the money. They could literally set up a maid for once a week. Like I said, she could go in there and like straighten it up first, so the maid
Mm-hmm.
would take care. Because some maids ain't gonna take care of that.
Mm-hmm.
And so I believe that she could have went in and straightened it up. She claimed she didn't even like, all she did was stand at the end of her mama's bed and talk to her and then walked out. So she didn't really check on her.
Nope.
But this is the deepest question of it about that sister, because let's be honest. I mean, it seemed like they were poor. I saw you show the picture of the house, Charlie, so they might have been poor. But my problem is the brother and sister who were actually there trying to help mom every day are locked up in jail. So if there was any type of inheritance, guess who it's going to?
The
The
sister.
sister that left and got married and did nothing.
And so
This
this
is the
is how
house.
you push this. Oh, see, that's a cute little house.
It's
That's
in a
a
little
cute little
neighborhood
house.
or whatnot. It's a little. It's only valued at 130,000. I looked that
Mm-hmm.
up, so it's not really valued at a whole lot. But
It's
I
Cape
believe the
Cod style.
father was. Now I
Mm-hmm.
do believe this. I don't believe anybody should have been charged because even the father who's passed. Here's my thing. He was trying to do the best of his ability. Was he the best? No. But the reason he didn't put her in a care home is because he couldn't afford it, and he
Right.
was trying to keep. They wanted him to sign over the home.
Yeah.
And if he wasn't able to pay, what would they have done? They would have stole this home out from under them. And I think he was trying to keep this home for the 2 kids he knew
Hey, pretty
that could
baby.
not take care of themselves. And I believe that, in my opinion, that he was like, even if I leave this world and my wife leaves this world, at least my kids will have a roof over their head. You know what I'm saying? That nobody
Yeah.
can take for them. And he probably did teach them how to pay the taxes or had something set up to where it would pay the taxes every year. You know what I'm saying? So they would
Mm-hmm.
be taken care of for the rest of their life. And that was probably his intention. And I don't think they had bad intention. I don't think they intended to do that to her. I think they loved her very much. I just don't think they knew what they were getting into, because I had a brother who was bedbound his entire life. From the time he was born till he died, and he was almost 18 years old. He never had a bed sore, never had a pressure spot, never had any of those things, but it was because we had years of practice and knowing how to do it. Also, he was tiny. They said this lady was a big woman. It's harder to
Okay.
pick up on somebody big. Also, she was opinionated. She may not have
Mm-hmm.
wanted them to touch her at certain points. She'd been like, "Oh, don't touch me." You know what I'm saying?
Oh, I
She may
know.
have fought them. You don't know the situation unless you're in it and you're living there full time.
But people are always going to try to give their opinion, even though they've never experienced stuff like that. They're going to always do that. And like you said, was the other sister older? She had to be older than them.
I don't know if she was necessarily older than them. Didn't catch the age of her per se. But I did catch the fact that she was very well educated. Did catch the fact that she could have came over there more. She did live in another city, but not too far where she couldn't come see them. It may have not have been, she might have not have been a bit over there, like I said, every day or some situation like that. But she said she came down every 2 to 3 months by herself. Well, during those every 2 months that you came down by yourself, why didn't you help your father pick up the home and clean up a little bit and hire a maid service if you had, and maid services in those areas are probably not that expensive because you could probably find somebody.
Yeah.
And, here's the thing about areas like that, because I know that because I live in these areas, right? I live in these areas. There are people you can hire for very cheap to come over on the weekends.
Yeah.
And to sit with an elderly person. You even have people who will do it for a weekly pay. And the pay is not as expensive as you think it would be because they come over in the afternoons after their regular job. It's extra money for them.
Yeah.
You know what I'm saying? My mom did this for an elderly lady. She was walking to her mailbox one day and she fell and she broke her hip.
Oh, gosh.
They put her in the nursing home, but she was getting worse in the nursing home to the point that they wasn't doing physical therapy. They were not trying to get her back up on her feet. They were just letting her lay there and pass away.
Languish. Yeah, they do the least.
The grandson, knowing that we cared about her so much and we lived next door to her, he asked my mom. He knew that my mom was a CNA previously. He said, "Would you help me get her off her feet?" And my mom goes, "Yes, I will." And they set up the perimeters and all this. We actually had a intercom put into our house for her.
See?
So if she needed it, my mom during the middle of the night, my mom could rush over there. My mom had a key to her house. You know what I'm saying? Because she wanted to be independent. My mom got this lady from not walking to where she could get up, she could walk, she could do her own hair, she could take a bath. She went from being completely bedbound to being able to do all these things because she did the physical therapy with her. She got her independence. You know what I'm saying?
I do.
And lived a lot longer because of my mother, and eventually came to the point she didn't need us anymore.
See, and that's a blessing. That's a blessing. And people take people who do that for granted.
Oh, her daughter tried to start mess and with my mom because the grandson would buy my mom drinks to put in the house. And he even would get to the point he would buy me ice cream when I came over there because I always thought of the lady as a grandmother figure to me. And he would buy my mom stuff to keep in the house when she was there. So if she needed a little snack or a pick me up or something. The granddaughter, not the granddaughter, the daughter came in one day and saw my mom sitting there with her mom watching TV and drinking a drink and eating one of her snacks that the grandson got her. She said, "Well, so what you doing over here? We paying you just to sit on your ass?" And my mom's like, "Nope, I ain't taking this abuse because I'm going to tell you right now, I'll quit right now." And my mama went home and the grandson came over there and he begged my mama. He said, "I promise you, my mama will never set foot in this house as long as you helping my mama and she going to leave you alone." He was begging, child. And
of course.
He apologized profusely because it was after she done had her bath, after she done did all her morning things. She was just sitting there watching her stories. You know what I'm saying?
See? And mama was probably just as happy and content.
She was just sitting there. She had just the lady didn't know because I was over there. My mom had just washed her hair for her and fixed it up for her and blow dried it and did all that nice stuff and, did the lotion on her and stuff. And so she was sitting there and her hair was drying while we were watching the stories.
See? And people don't appreciate people that do that. You know?
She know that she thought my mom was drinking her mom's things. I'm like, no.
Oh my good. No, we bought this for your mom. I mean, come on.
That's what the grandson too did. The grandson got his mama's butt, y'all. But to see these two kids, and I look at them as kids because if their mental faculties are lower than me, then to me, I don't care if they're grown 50-year-old people, they're still kids to me because they have the mental faculty of a child. you know, it's sad to say that they're going to spend the rest of their life. They're probably going to pass away in prison, and they did not get a fair shake. In my opinion, what should have been done, if in case this was disproven, maybe I might feel different, right?
Right.
But they should have had evaluations done on them, pulled their school records, pulled their work records, give us a history of these two individuals to know, were they mentally able to care for their mother? We
I
don't
wonder,
know.
is it too late? Is it too late for them? That's what I'm
They
wondering.
can appeal. I hope that's why
I hope
we were
they
talking
do.
about, and I did show the Innocence Project's contact information and their website. I'm hoping
Mhm.
someone in either, because you know they have the Disability Act,
Right.
and I'm hoping someone, you know, maybe this catches media attention, not just me covering, anybody covering. I hope a bigger YouTuber than me catches this and
Mhm.
covers it, and possibly somebody can get in contact with the Innocence Project and get them better representation, because this is sad to see two people who, and I come from a very poor background, like very. I was not middle class. I was poor. I admit it. I'm not ashamed.
No,
You know what
not
I'm
at all.
saying? And I know that they did not have the money to be able to afford attorney in the first place. They were railroaded because nobody thought in this whole process. The defense called no witnesses, no, they, you know, like even in the Sarah Boone trial and every other trial we have covered here as of yet, the defense tries something.
Something, at
All
least.
they did was cross-examine and give opening and closing statements. They brought nothing else to the table for these two kids.
That's so sad.
I know they
Public
grown-ups,
defender.
but they
Yeah,
older
but
than I
they're
am.
kids.
But
They are kids, though, in the sense, like you said, of their mindset.
I
They
know
are
Jay
kids.
Dizzle probably feels the same way, because we were talking about this over at the Mrs. O, and we were talking about nobody did evaluations. The defense did nothing.
But get paid. And they
Well,
feel
but
like
see, that's the problem that I had with that, because with the sister, rather, the older sister or whoever she is. Because y'all, in the first, I would say 2 years that I was here, yeah, I kid y'all not, I went back to Mississippi at least 10 times.
Mm-hmm.
And my relatives had to tell me, look, you in Atlanta now. You can't be driving 6 hours for any and every old thing, but I did.
Right. And that meant a
And
lot.
yeah, I get up in my car and drive 6 hours to go, but then also I was going to check on my house too, because I
Mm-hmm.
had my house still there. But I'm gonna always check on everybody, make sure that they okay. So the fact that this woman still stays in the state of Tennessee, only a couple of counties over,
Dang.
and
That
she ain't going back over there to check, but I was going to check on my relatives and driving 6.5 hours to get there each way.
yeah,
6.5 hours there, 6.5 hours back. And I did that multiple times. Because that's what you're supposed to do.
exactly. Exactly.
And you got to think, you lived all the way like in a whole nother state. That's like, you have to cross to get from Atlanta in Georgia, you have to cross through, you know, different areas. And I think I'm not mistaken, you're from down south, right?
Yeah, I have to cross through Alabama every single time I go home.
And you got to think also, when you're coming from the Birmingham area, because I know, because when I go to New York, I have to go through some of that way sometimes, or go through Tennessee, right? That leads you into North Mississippi. So that's still a 4-hour drive from north to south, and sometimes
Yeah.
5 hours. And then you got to add in that stretch from Atlanta all the way to Mississippi.
Shit.
So that's not a short drive. You know what I'm saying?
Mm-mm.
Shoot.
And
No,
it
that's
shows
what I'm telling you.
dedication.
It's about 6.5 hours one way. And then 6.5 hour drive going back.
Jeez,
And I did that whether it was going for a funeral, whether it
Mm.
was going for me to check on one of my sick relatives, whether it was for me to go check on my house, whether it was because one of my little cousins got sick and was up in the hospital. I was driving there and I ain't have no problem with it. So for me, it just feel like this woman might have had a 2 hour drive, and that was too much for her.
That's sad.
Girl, how?
That's why I'm so glad that my mother-in-law and father-in-law are moving down here to Mississippi and not New York, because that's a 2-day drive most of the time.
It is.
And so that they can be closer, because myself and I, if you have to go into a home, I'm gonna be there every day or every other day at least. I'm checking on you. I'm making sure, because I know for a fact my mother worked in a nursing home, and the people who do not have family to come check on them, they do not treat them right.
No.
I have seen it myself. I've seen them put them in wheelchairs and just sit them out in the hallway. It's the saddest thing you will ever see in your life. And every time I leave, it's hard for me to visit nursing homes, because every time, when you know how big my heart is, right?
Mm-hmm.
Every time I walk out of them, just tears are streaming down my face, seeing some of those elderly people who nobody's checking on them. Nobody cares about them. It breaks my heart into a million pieces. I cannot handle it. You know what I'm saying? Mentally.
Yeah, because they'll latch on to you and they'll be like, hey. I mean, and it hurts. I mean, there was a lady who was hoarding her in the place, hoarding her Raisin Bran, them little boxes of Raisin Bran, and to see that and nobody's visiting her, it's just, oh my God, it's heartbreaking. That's why I had to take my mama out of there. I was like, she coming home.
Well, that's what I felt about when my grandmother, she had a major stroke where she couldn't open her eyes.
Oh,
it affected her to where, it affected her, like she wasn't, they basically told us it was end of life. She had a major stroke and it was nothing they could do. It was severe brain damage. So, it was just basically making sure she was comfortable for her last days and trying to spend as much time as we could with her. We knew what was up. You know what I'm saying? Because she was actually in a coma for a little while, and they had her in the ICU and whatnot.
Yeah.
And so we thought that she wasn't even going to make it out of the hospital. So for us to get that extra time, it wasn't but a month or so or two, a couple months. It was a couple months. But those couple of months was more than we thought we were going to have.
Right.
And, I would have never put that kind of responsibility on someone who I knew could not take care of her.
Right.
Because I wasn't going to have my grandma living like that. But I literally went to her house every single day. Thank God my grandmother at the time literally lived right next door to me. So I could literally walk over there if I wanted to. You know what I'm saying? That's why I didn't mind leaving the other person that was living with her at the time with her, because he could pick up a phone and I'd be there in 5 minutes. Right. You know what I'm saying? That's why I didn't mind it. Now, if she had lived in where she used to live, I would have moved in with her. Point blank, period. But she didn't live, but I could literally walk around the corner. Literally.
That's remember how it used to be, families would always have like large pieces of land, so everybody be living like next door and around the corner and all.
That's what it was. She had a boyfriend who passed away, and he left her all of his money and everything else. So when she got that money, thank God I talked her in this, because she let some dude scam her. But there was a property that came up for sale that was right beside mine that was actually connected to my property. And I told her, I said, Granny, it's up for sale right now. I want you to buy this so that you don't ever have to worry about, rent again. You don't ever have to worry about not being able to have a roof over your head or anything. She bought the property, and that literally connected to ours. So now both properties are consolidated. You know what I mean? Yeah. But I told her, I said, I want you close to me, because she was getting up there in age. And that's the same thing about my mother and father-in-law. They bought a property that's maybe 10 minutes from me. I want them close and not all the way up there, because if something did happen, I wouldn't be able to go check on them, Yeah. And I want to be able to go check. I want to be able to make sure you're okay. That's like my mom and dad. My dad's a big man. My dad's 6'5", and he's like 300 something pounds because of his height, right? He's a big man. And he told me, he said, daughter, now I know you don't want to put me in no home, but if it ever comes down to it and you have no choice, you're going to have to, because of my size. You're not going to be able to pick up on me, because I'm a big man. I said, well, I'm going to tell you something, Daddy. Until that time comes, when I have no other option, you ain't going in no home.
Right.
Now, when it comes to the point of I don't have any other option, you best believe I'm looking for the best one we got.
Yeah, oh yes. But the one thing I hate is the smell in there. I mean, I know they got to keep it clean, but it just has that smell of like like too much cleaner and too much bleach and no care, no actual care.
It's also, if you look at this case too, though, you think about those two adults who didn't have the faculty to take care of her. And the father, I do believe he tried to do the best of his ability, but with him working, trying to take care of her. And I do believe that's one of the things besides brokenhearted syndrome that led him passing so soon after her, because it was literally 3 months. 3
Wow.
months after she passed, those kids not only lost their mother and had to watch her wither away, but 3 months later also lost their father. And they said he was an ex-cop, and he was like, when he puts his foot down. So even if they would have wanted to put their mother in a care home because they could have been afraid to speak up and say, hey, Dad, this is too much. I can't handle it. Because their dad was an authoritarian figure,
Mhm.
and they may have not been able to speak up. So here's the other point of view from that. The father was the one that took responsibility for her. What if they were too afraid to speak up and say, Dad, I can't do this, or, whatnot. And he's trying to take care of 2 special needs adults and
Yeah.
his wife and go to work, because even though he retired as a cop, he was still doing outside work to make sure he could afford the things she needed and
Yeah.
pay for, to have insurance and stuff and to be able to pay for things. So he came out of retirement to go back to work at his age.
Wow.
So, this situation, and with them being poor and black, they did not give them a fair shake. Point blank, period.
And so they just pushed away by the system.
Mm-hmm. They just wanted somebody to blame. We said that the other day on the MSOs. They just wanted somebody to blame, and those 2 kids just happened to be the ones that they blamed.
That's why I say somebody was pushing from the other side. I believe, like Jay said, that's maybe an inheritance involved. That house, for one, whether it's worth 130,000 or not, that's still sellable.
Also, she
Um,
wouldn't have to worry about taking care of them.
yeah, yeah, she don't have to worry about taking care of them. They can just wither away because obviously her thoughts were on her family. Okay, she kind of disconnected, is what it seems like, from them, because she was doing her own thing. Now I can't fault no child for going out and doing their own thing. That's why I push mine out. Go do your own thing. Do your thing. I'm all right. Do your thing. No, you ain't got to be coming home all the time. No, we can just FaceTime. Just keep in touch with me, because I wanted them to have their own lives. They need their own, they got to go out here and forge their own independence. I don't want them to feel responsible. But I do know and have faith that, God forbid, something really bad happens to me, I know that my kids will be there. So, I'm glad of that, but I will not put that responsibility on them now. I'm going to keep moving as much as I can. I don't care what the doctors say. You can't tell me I can't walk. I'm going to keep walking. I don't care if I'm walking sideways in a curve. I don't
Girl,
care.
I always said I'm going to walk till the wheels fall off, because I got told the same thing. You got to think my injury, right, that I
Mhm.
have came from a bus accident when I was only 15 years old.
Oh, see,
It was not of my volition or my choice, right? It wasn't because, and not to say that yours was a choice, but to say, like, I didn't go injure myself at work. It kind of makes me feel like it was stripped from me. Choices were taken.
Yeah,
Because a lot of things that I wanted to do as a young adult, I couldn't pass physicals to go do,
yeah.
because the back injury started when I was 15. My first wreck at 15 was I was on a school bus. We were stopped. I was moving to the front of the bus because I used to sit in the back of the bus, and the guy was going like, I think it was 85 and a 45, and he hit the
Jesus.
back of the bus, and I ping ponged between the seats. And then the
Now
second
say,
one happened a year later in another school district, because I happened to move. And if the bus driver was not smart in that wreck, we wouldn't be here today, because the left side that he pulled the bus to, the brakes went out and it started wobbling and stuff. And we were going down a hill and he could not stop the bus. So his only way to stop it was to jerk it to the left. If it had went off to the right, we would have went down an embankment and the bus would have rolled into a field.
See,
And-
that's a blessing.
But
So, I mean-
Charlie, now I gotta call you to the carpet, just like I call out Pizarro.
Call me
Why
out.
y'all didn't sue? Why y'all didn't
did.
sue?
I did. I got screwed by a lawyer. My first suit, I did sue. And we started the case when I was 15. The lawyer didn't do anything until I was 21. Even when I went to court, my lawyer tried to screw me then, and the judge stopped it and said, I don't think this is an adequate amount for the extent of her injuries, and you don't know what this child is going to deal with for the rest of her life.
Yeah.
But when I was 21 is when they actually tried to come back with a settlement. I was stupid. I was foolish. My child was only a year old, and he was going back and forth to Le Bonheur and going back and forth to Jackson, and they offered me $6,000, and I needed it at the time. And then I get up there, come to find out they only gave me $3,000 because they stated that they had to pay for some stuff and all this other stuff. They screwed me really bad.
Yeah.
And the sad part is that same lawyer is now my mayor.
Oh,
And went
my
on to be
God.
my state representative. So no, I don't like that man. And if you ever hear me talk crap about Jason Shelton and Associates, I will always talk crap about those people, because David
Absolutely.
Butts told me if I hadn't assigned him as my lawyer, I could have got over $250,000 or more, and the rest of my
See?
medical bills for the rest of my life taken care of. But they had a thing with the insurance company, and I got screwed. So be careful who you hire as your lawyer.
Yeah, man. That's messed up. That
Well,
is
I mean-
really messed up. Hey, Big Red.
And it is messed up. It's messed up, Charlie, but I'm happy that you explained it to me. Because I'm like, Pizarro claimed that she fell out of a roller coaster and bust her head wide open, but
Oh.
her parents didn't sue. And so that's the reason why I had to ask you the question. Because I'm like, something like that happened on the school bus,
Yeah, exactly. That's
and
what I
ain't
was
nobody
thinking
getting no
too.
money.
That should have been big money.
I really got totally screwed on that situation. And I admit my fault of signing that piece of paper, but at the time I didn't have a car. My car had messed up, and I had
you
paid
dealing with
somebody to
children.
take me up there. I had paid somebody to take me up there, or was offering them payment once I got the check. And I needed the money to get back and forth to my son's doctors. And at the time I was like, well, shit, this has been going on for 6 years now. They've done nothing. We went to court one time. The lawyer they sent somebody with me who didn't even know my case, right? Had never spoken to me. I didn't know this person from Adam. They tried to, at that time, only ask for my doctor's bills to be paid for, nothing else.
That's
We
ridiculous.
didn't know that. So, we didn't know litigation. We were poor people. I admit they screwed the crap out of me.
Well,
And
they prey on ignorance, because if you're
Mhm.
not familiar with the way the system works, they prey on that.
so I got. I
Yeah.
admit it. I got.
But that still ain't your fault that you got. You know what I mean? But you had to do what you had to do when you got kids and you young and you trying to make it. You do what you got to do sometimes. I mean, you've been waiting for years. So it's kind of like, man, look, somebody's offering me a few $1,000s. I got things I got to do. I got to get from A to B. You got to take care of your kids, especially with them being special needs. I mean, and I've been in several car accidents, and I've sued everyone. Every time I've sued Jada don't play, but I've been suing like a mug. I'd be right up there in the courtroom like I'm somebody's lawyer. I thought Diddy could hire me. That's how good I was getting with the settlements, because they don't really care about you when it comes down to the lawyer. I mean, because they just there for a while, get their job done, and going on about you ain't nothing but part of a payment on their summer home.
I said
So-
never again once that situation happened. And if
Oh,
I had
yeah.
known, I wished my favorite lawyer, which I'm not going to dox
don't
him
dox
because I
your
love
favorite
him.
lawyer.
He stopped working in accidents and stuff when this happened. He now only deals with like disability claims and family law and stuff. I wished he was still doing accidents. I'm gonna tell you, this man, when my mom had her accident, shoot, he went balls. Well, this man right here is amazing. So anybody that I know in my area that goes through disability claims, I always recommend this man because he is the most. I just sad that at the time he had stopped covering that law, because if
Right.
he hadn't a child, he'd have been my first. I've been
First
calling
pick.
him. Yeah, he from my hometown, and that man's like family to me. But I went through because my grandmother
What?
had chosen.
Well, next time you call him and ask him for a recommendation.
I
Don't
show
think-
am, girl. Because I
Don't
went
but
through
think
ain't
for
no
a
somebody my
next
grandmama
time.
second
told me
that
to.
I go and like find a lawyer on Google. No, I need a
Yeah.
recommendation.
My
Exactly.
grandmother had went to him and she thought he was cool, and then come to find out his father actually got after my situation happened for like taking money and all these other stuff.
Oh,
And
Lord.
like their family name is not the best if you really
Oh,
look it up,
jeez.
but I didn't know that at the time.
Right.
And the doctor they were sending me to ended up losing his license because he was giving out free medications, and they called him a pill. What do you call that? Those people that
Yes.
just hand out pills.
Yes.
Child, he had me on so much medication when I was 15 years old. I was on trazodone for sleeping. I was on this other
Yup.
medication and this other medication and all kind of things. So it also had to deal with the fact that he was my main what do you call that person that stated what my medical condition was,
Your
that they
main
tried to disprove
representative.
it because of
Yeah.
him losing his license.
That's messed up. And I feel you, because there was a doctor around here that was the same thing. He was,
They
that
were
Oxycontin
crooked.
ain't work. Oh, try this. And they did that with me. Oh, that's not working. Okay, try this. Oh, you've been on this for 6 months. Try this. And see, mine was exasperated by accidents. But I was born, and this is one thing that I tried to get them to do for my kids when they were born. I said, look, I have spina bifida occulta. They didn't catch it until I was 26. I said, is there any way that you can check my kids? Because I wanted all of them checked so that anything that needed to be fixed can be fixed or helped. And they told me is that they could not check for anything like that until you are an adult, because that's when your spine is finally completely extended and they can see it as clearly. It's not as clear when the children, when they're kids. So unless the spinal cord is actually sticking out of their back. Luckily, I went past that. I was blessed where at least it's closed up in the back and muscles and stuff grew over. That's why I was able to move as much as I could. But they warned me from the beginning, don't go out here and think you can like be up in the gym. Because when I had that gastric bypass, I was ready to go to the gym. Let's go to the gym. Let's do this. Let's do that. Because you start all of a sudden 100 pounds is gone. Now you start feeling lighter. You can move. You can go. You can do. And the doctor's like, look, don't go out there and be crazy. And so yeah, they kept me from everything. Girl, I wanted to ride roller coasters and all the stuff that my big behind couldn't fit on. Oh, I wanted to do it. I wanted to do it. But accidents after that, it was like a 2-year period of time where tow trucks kept hitting me. So I guess I know why me doing roadside ain't nothing but God, because tow trucks kept hitting me. I got backed up on in a pink truck by a flatbed, and I'm like, you don't see this big pink Jimmy back here? I got hit by another one, tow truck, and I'm like, why is nobody seeing this truck? And then somebody else ran into me, a big truck, the ones that people like, they have the thing on it to extend it up so that people can like do signs and stuff like that. That hit me. I was like, you know what? I'm getting rid of the pink truck. If you can't see a pink truck, I just don't know what else to tell you.
Child, I'm gonna tell you something. When you
See you later, Jay.
go through, okay, huggies. Thank you, Jay Dizzle, for being here. But the situation, like you're saying, with the condition of your back, and the problem with that condition is over time, the older you get, the worse it gets. How I re-injured my back and made it worse is when my son had his surgery. You got to imagine he was 99 pounds, and that's without the leg stabilizers, which have metal in them. That's without the cast on his legs, without the extra weight. You know what I'm saying?
Right.
And I injured myself, but I wouldn't have it any other way because
Exactly.
my son can walk good now. My son, may have a slight limp, but he can get around just as good as anybody else. So I don't care.
And that's
And
a blessing.
yeah, so and the more we age, the worser it gets.
It does every
um,
year.
with mine, I have I think it's 4 slip discs in the bottom of my back, 2 in my neck. They're perforated, torn. I got bursitis in my neck and my back.
Yep.
Um,
Shoulders everywhere.
and it's they're leaking, and they told me at any time that they could pop. And when
Yeah,
they do, I'll know because I'll be in the worst pain I've ever been in my
you
life. But
sure will.
the doctor also told me that it will degenerate over time and get worse, and it may spread to other ones because mine's in my lower back.
Yep.
From
L4 and 5, right?
mine's L4, 5, and 6.
Oh yeah.
And then it's C2 and C3.
Yep. Right up there at the neck.
And so and it, it's something I have to deal with for the rest of my life.
Yeah.
I've had to deal with since I was very young.
Yeah. You always had back pain as a kid. You just didn't know why your back was hurting. It's like ain't no other kids complaining about their back. So you don't feel like you should be complaining like, oh, my back hurts. Like, because, you're 9 years old, your back hurting. And they told me, they tried to get me not to have those last 2 kids of mine because that it could paralyze me. And I said, no, I feel like they're here for a reason. And I would never just say, nope, I'm not going to have no kids. I mean, if they got in there, then they got to come out. And I was going to make sure they came out the best possible way they could. And they're a blessing.
That's why, when we talk about, the Roe versus Wade thing, right? And this goes into wellness for women.
Right.
Me, myself, and I, the reason I try to take every precaution. I take the Depo-Provera shot every 3 months because it's the only one I can take. Here's the thing with my liver condition, I cannot take anything with estrogen in it. Do you know how many birth controls have estrogen in it? And what that narrows me down, I cannot do the NuvaRing. I cannot do the patch. I cannot, there's only one of the inserts I can do that go inside of you. One on, the one in the arm. Yeah. There's 2 different versions of the, Mirena. There's only one of those I can do, and it's the progesterone, not the estrogen. So I can only use progesterone products. It cuts down on birth control pills on the ones that I can use. I don't like the pill. I have really bad ADHD, so I'm not going to take it every day as you should, and it's not going to be as effective. Right. And so I know that. And if I missed one, then I would wind up. So that's why I went with the shot. It's every 3 months. I was going to do the one where you put it in the Nexplanon that you put in your arm. I don't like the ones that you put on the inside of your uterus because they have so many problems from it. Yeah. So I was just going to do the one you put under your arm. Well, here's the thing that happens with that. There is a percentage of women who get intermittent bleeding from it. I can't take the medication to stop the bleeding.
Yeah, because
of my liver condition.
Right.
It's naproxen sodium. Naproxen sodium you cannot take if you have a liver condition. So therefore, if I had to, I would have to stick with it for a month or 2 and deal with that until I could have it out. So I've taken the Depo-Provera before. After I had my son, I took it for 2 years. But then I was like, why do I need it anymore? I'm not doing anything with anybody. And if I get pregnant, it's Jesus or the devil. You got to make a choice. That's what I always told the medical professionals when they go, is there a possibility you're pregnant? I said, unless it's Jesus. And they go, why do you say that? Because if you're not having sex, how are you going to get pregnant?
Exactly.
It got to be a miracle.
A miracle or God's joke on the world to make me pregnant with the next Lord.
And so now that I'm in my relationship, I got back on the Depo-Provera because I took it before with very little side effects, and I take it every 3 months. You know what I'm saying? I didn't have any problems with a previous relationship, no pregnancy scares, no nothing. I didn't have any problems. You got to find the one that works for you because each of us are different. Like I might be able to take the Depo and you may not be able to. You may be able to do the Nexplanon. I may not be able to. It just depends. And I didn't want to take the chance being that percentage of woman who had the intermittent bleeding and I can't do nothing about it.
Exactly.
So that's why I didn't do it. I'm like, it'd be just my luck. I'm gonna be one of them women, and then I'm gonna be over here acting like I'm already have bad periods as it is. I wished I begged for them after I had my son because they told me that there was a 50% chance that the same thing that happened during that pregnancy could happen again.
Have you
Right.
ever thought about having an ablation, or do you want to have more kids?
I was begging them to tie my tubes, to cut,
Right.
tie, and burn. I was begging them to do it, but they would not do it because I was only 20 and I only had one kid. You have to be, for them to do that, you have to be over the age of 25 and have at least, I think they said 3 kids.
But you have medical issues, so
Yeah, and they wouldn't let me do it. They
that's
refused.
messed up.
I told them I would sign any paperwork you wanted me to sign. I would put it in
Right.
writing. You can videotape me saying it. I promise you, I ain't never gonna sue you. I can't have any more kids.
Right.
You know, things may change in 5-10 years. You know, medical advancements. I'm like, and still medical advancements. I'm 37 years old, and they still
Right.
ain't here. So what you talking about? You should have did it when I was 20.
Yeah, it's to me, it's still too. It's so dangerous that they went on ahead and said that they would do the ablation, and the ablation, like I was like one of the 5 or 10% where it stops bleeding completely, and so I have not had a period in so long. I forgot what they was like, and I ain't even mad at it. It is the best thing for me, and it. No medication. You don't have to worry about the estrogen. You don't have to worry about, you know, if you're getting enough this, if you're getting enough that. You can just live. And I've loved it. Now, it will put you in the menopause early, which was funny to me. But now that that's over, thank God, I just feel
It's called
more
an
free.
abrasion. Is that what it's called?
Ablation. ABLATION. It's a no. Wait a minute. Ablation. LA. Wait a minute. ABALA. You know what? God dang it! I got Google right here. Wait a second.
Ablation.
Not an yeah, that's that. I said that. That's definitely wrong. Let's see. It's an ablation. Let's try that. Ablation. Ablation. Okay. ABLATION. Ablation surgery is minimally invasive surgical procedure that uses heat or cold to destroy abnormal tissue in the heart or other. That's a whole cardiac one. We talking about one for. We're not talking about a heart ablation. We talking about a uterus.
I'm looking,
Yeah,
I'm looking that one up right now. It's called endometrial ablation.
Yes.
Is a procedure that uses heat or cold or different types of energy to destroy the lining of the uterus.
Yes.
If heavy periods are a problem, your doctor may recommend it. Which I did have that problem, and I
Yes.
still have pain. Even though I don't have periods anymore, occasionally I still have pain in my right ovary.
Yeah.
My mama had the same problem. They ended
yeah.
up having to do a partial on her because she had so much scar tissue. You know, she had cysts on her ovaries and
Yeah.
stuff. I probably have it. I just ain't never got it checked. But
I got a couple too. I ain't
Yeah.
even mad at it. Look, I just deal with it, and sometimes the cysts can go away. They can just disappear. I haven't had any problems with it, and I don't play around with my GYN doctor.
they rupture, and you can tell when they rupture. I'm gonna tell you this. I've had a
Yes.
few happen to me, and it don't. It just causes a lot of pain. You just got to make sure you don't run no fevers. Because here's the problem with those poor women. You know, you think they would do something about these, but no, they'll tell you. This is what they'll tell you to go to hospital for. They'll go,
Yeah.
well, you're not running a fever, and so you don't have an infection. So just take this pain medication, go home. You'll
Yeah.
be better in 4 or 5 days. It should
Yeah.
clear up on its own. So guess what? I don't go to the hospital when it happens. I just make sure I don't run no fever. I make sure that I'm okay. You know, I don't start having no funny symptoms or nothing. Good morning, Miss Official Lovejoy.
Hey, baby. It's hard to, you know what, you get on your nerves when you see these folks and they tell you, oh, you'll be okay at home. You can just do this, that, and other. And I just want to fight them. I'm like, do you realize I wouldn't even be here if it wasn't this bad? I mean, hell, I
They tell us to take Tylenol. And they,
Tylenol.
especially these men doctors who ain't never felt what a fibroid feels like, ain't never felt what a cyst feels like. You don't know this pain. Trust me. If you did, you'd be on the couch crying right now. And you're telling us to take a Tylenol. Come on
They
now.
couldn't take it. They'd never be able to take it at all. Never. And that pain, oh my God, when you're dealing with your uterus and you're dealing with all, they ain't had not near baby, not near push, not near person out.
Not a
They ain't
nan
done
nutter.
none of nothing.
They don't know. I'm telling you, a lot of these, like some, and you're lucky if you do get a female doctor, which I so happen to be amazingly found a female doctor who had
Mhm.
been through some of the things and knew how the pain really was. And because some women are blessed who to
Mhm.
not have that pain and not have heavy periods, and they don't know what it's really like, and they better count their blessings, because I'm gonna tell you something.
Absolutely.
I have literally been so anemic from
Mhm.
one that I literally fell asleep midday because I could not hold my head up because I was so exhausted from blood loss and anemia that I was so, like, I would be so exhausted during mine, and it was really, really bad.
Uh-huh. Oh yeah, that's why I eat ice the way I do. Why I eat the McDonald's eat them because I freeze the McDonald's tea, and I love it because it's the ice and it's from the anemia, and it's something that you wind up dealing with all your life. And can no man understand this? I mean, this is why I always deal with women gynecologists. I will not. They don't care. The men do not care. They are like, oh, you can take it. You be looking at
They
them like I
have
in your
bec-
face.
because now this is what I love to tell a male doctor. I said, how
Mm-hmm.
about this one? How about I thump you in your balls right now and
Mm-hmm.
keep doing it over and over and over again, and to the point that your balls get sore, and I keep doing it and then keep doing it, and then you pass it. Now the only male doctors I know that understand the pain a little bit is I tell them, have you ever passed a kidney stone? And they go,
There you
yeah.
go.
I go, that's what I'm feeling right now, but constantly all the time. Try for like 2 or 3 weeks or more, and add a
Mm-hmm.
little bit of extra on top of that. I said, that's what and that's the ones who actually kind of understand, or they've seen their wife go through it.
Mm-hmm.
But you have to be lucky to find those, because and I had this one doctor, it was a student doctor, and I'm gonna tell you what, and then this has nothing to do with female products. This has to do with other stuff. This doctor thought he knew everything, child, and
Mm-mm.
he would not listen to nothing I told him. I told him that the heart medication he gave
Mm-hmm.
me 50.
Uh-uh.
I
Not too
literally
much.
am barely hypertensive, barely, right? I'm not
Right.
even he gave me a medication that was 50 milligrams.
You don't need
It
that.
was
The
way too
Metrolopo.
much. I
The,
started having chest pains. I
okay,
mean, like
see.
chest pains. And he kept saying, no, it's your stomach condition. It's your stomach condition. That's what I was like, I know what my stomach condition feels like when it acts up.
Okay.
And GERD and gastritis can cause you to feel like you're
That's
having a heart
true.
attack.
That's
But
true.
this is different. With my stomach condition, I can't take aspirins and stuff, right?
Right. Right.
So
Did they ever try to put you on misoprostol?
I'm on
Or
lisinopril
Cytotec?
now. I'm on
Okay.
lisinopril, so I'm good
Yeah.
now. But there was aldomidopine, and it was 50 milligrams, and then he tried to drop me to the 10. He knew what he was talking about, and I told him, I said the only thing that made it feel better was I chewed up 2 aspirins, and
Yeah.
for me to chew up 2 aspirins with my stomach condition, knowing it can cause stomach pain after that,
Yeah.
and it made it feel better. That was a heart palpitation, homie.
Yeah.
You almost gave me a heart attack.
Honey, heart attacks ain't no joke there. I drove myself to the hospital. Me and the kids. I woke them up at 1 a.m. I
Did
said, I
Joe?
think I need to
Did
go.
Joe? What it felt like for me, and I'm gonna ask this because
Mhm.
I probably almost had one. It felt like at first it was my neck that was hurting, and then it went
Mhm.
down to my arm and my
Yep.
shoulder, and then it felt like somebody was squeezing my heart, just
Mhm.
squeezing like as hard as they could, and it
Did
felt
you
like
get the taste of metal?
no, but I felt like a dang elephant was sitting on my chest.
Yes. That's it,
And
boo.
I chewed them to aspirin, and within a few minutes, the pain was gone. It took just a few
Mhm.
minutes for it to kick in. And my dad almost gave me, he has a heart condition, so he has nitroglycerin, and he keeps
Yeah.
it in his pocket. He said, do you think I need to give you a nitroglycerin? I said, no, I think the aspirins will do. If they don't, and I'm still feeling this pain, I'm going to end up going to the hospital. I'll pop a nitro, and then I'll go to the hospital. But
Yes.
thank God I was fine. And then he tried to give it to me again, girl, and it did the same thing. And
You
it was a
know
lower
what?
milligram.
And that's when you switch doctors, because I will switch a doctor. If you is not working for me, you got to go, because I'm going. I'm getting up out of here from your care. I don't be playing around with these doctors. You're not going to take my life, okay? Not at all. Now, we got a hospital here that they people really hate. It's got a bad rating, but that hospital has saved me time and time again. They stopped that when I had the heart attack. They sent me there so quick. I was so scared to leave my babies because they was 11, 12, no, 10, 11 at that point. And they went to the hospital with me, and I'm scared to death to leave them. I'm like, I can't leave my babies. And the only way they got me was one of the nurses says, I will personally look after them. I don't want you to worry. We need you to get yourself right. And girl, you talking about scared because my mama was staying with my cousin at that time, and you talking about scared. I just did not want to leave my babies anywhere.
I know how. I'm gonna tell you something. I know that feeling because my son is only 17 now, or will be
Mm-hmm.
17 soon, and it was in 2019 when my gallbladder went to going bad again, and it caused my liver to go bad again, and that's when I got diagnosed with NAFLD. Um,
Mm-hmm.
and I thought my liver was going bad again. You talking about somebody scared because I'm like at that time, that was 2009, 20, 21, 2, 3. That was 5 years ago. So he was
You right,
he was
James. That's
13. He was 12 years old at the time.
mm-hmm.
I didn't want to leave my son at 12 or 13 knowing that his daddy ain't no daddy. You know what I'm saying?
Right,
His daddy
right.
don't care about, and my mom and daddy are getting older in health. And what if they tried to put my son in the state?
Yeah.
You know what I'm
See,
saying? I was scared, child.
oh yes. The only good thing I knew is that their father is a decent daddy. He was a horrible husband at point, but he was a decent daddy. So I felt like, okay, I can leave them. He'll come get them if need be. But I still had my cousin here. She was taking care of my mom, and my aunt had just passed away from the pancreatic cancer, and it was just rough. And when they showed me, and this is the thing that I'm nosy, so I want to see what was wrong with me. But they showed me the blood clot that was literally tearing my right carotid artery in two. And if I had not have driven to the hospital, they said if I had been 10 minutes later, that it would have torn and I would have been gone. And you talking about scared, you be like, oh, okay. Oh, wait a minute, what? So I know, when you are blessed because you know that somebody got you. Somebody made me go to the hospital. It felt like I had heartburn, like horrible, horrible heartburn. And I was just drinking big cups of ice water and eating the ice and just I had so many cups, the big 40-ounce, 32-ounce cups, like a big gulp cup full of ice water. I was just sucking it down. And then I finally said, let me Google the symptoms of a heart attack. Just Google it and see what they say. And sure enough, as I was Googling it, I started tasting metal, tasted like copper. And
They
even though
also
even though
said
I ain't never sucked on no copper before,
they
I
said if you
yeah.
smell like toast, like you smell like burnt toast or toast and there's
Oh.
no toast around,
Mhm.
that's the signs of a stroke. Get to the hospital as soon as possible because it's something about a lot of people smell that. And it's a weird sensation when there's no toast around you
Right.
whatsoever and you smelling it. They said it's something about people smell toast. There's different, and here's another thing a lot of people don't know. Sometimes women and men have different symptoms.
They do.
Sometimes with women, it can feel like a pain in your shoulder, and it doesn't necessarily always be a pain in your chest. So you're
Mhm.
thinking you're having shoulder pain. You done pulled your shoulder out of whack, and you over here having a heart
A
attack.
whole heart attack.
Yeah, so you have to look up, like, anytime you yourself feel weird, you know what I'm saying, and you
Yeah.
feel pain, pay attention to your pain, because that's why I don't try to take too much of my pain meds, because I
Me
want to be able to
neither.
feel some pain, so I'll know if I stubbed my toe the wrong way and I'm broke it, and I actually broke the top of
Okay.
my foot once. It sucked, but
Girl,
that's
I done broke 3 toes. I
yeah,
done
I done
broke
broke
3
my
toes.
toes all over the place, child, hitting them up against stuff because I'm clumsy
Yup.
as all get
Me,
out.
you, Charlie, I swear we was related. I swear you was my cousin. Because I'm good for that. I will kick something in a minute, be act like, oh, how that happen? Next thing you know, I'm at the hospital with a broken toe. It ain't like they can do a whole lot, but tape it up. So you feel like, why am I even here?
Yeah, all you got to do if you get a broken toe, let me tell you something, they ain't gonna do nothing. Get
Mm-mm.
you 2 popsicle sticks, put it on that toe, wrap some tape around it, because that's all they're gonna do is tape it. That's
Yeah.
to keep it straight, or tape it to the other toe. So that's to keep it straight when it heals back, because that's all they're gonna do for a broken toe. I'm just telling you.
That's it.
Even certain other things, that's all they're gonna do is they're gonna tape it to the other one so it stays straight when it grows back as it should when it heals. They ain't
Exactly.
they ain't gonna do much else for it. So just tape it to your other toe.
That's
what they do at the
we are
hospital.
giving you healthcare advice. It may not be what your doctor will tell you, but we are giving you first-hand experience of a broken toe, just in case.
And we ain't no professionals, so we ain't necessarily telling you what to do. We're just telling you what we did. Okay?
Exactly.
So if something happened to you, we didn't. It ain't our fault.
We are not responsible. We are not responsible. Let me tell you how I broke my hand. And I had long nails then. They was like double the length as what they are now. And I was working at the front of the doctor's office. And so I was basically just a poster girl sitting up there checking people in. But it was snowing and it was still some ice on the ground. So I get off. It's 7:30. I'm hungry. I'm ready to go home to the family. And I go and order some fish and French fries or stuff like that. And I get to the place, right? I pull up. I see it's a little ice out there. So I say, okay, I'm going to be careful. I get out. I still got my tennis shoes on because I love some white tennis shoes. You can give me some white tennis shoes, I'm good. So I get out and close the van door. Did not know my shoe was untied. Okay. Stepped on my shoestring, fell, bust my whole right side, broke half of my right hand, and my fingers, and my nails did not break at all. Okay, so I realized this is how you get embarrassed when you fall. You don't want nobody to realize you're on the ground. You hop up. I hops up. Oop. I hops up, didn't tie my shoe because my fingers was crooked. It was falling, looking like crazy. I go in there, get my food, and then I go to the hospital. I didn't leave my food there. I went and got my food, and the lady said, "Are you okay? I saw you fall." I was like, "No, I'm fine. I just need my food. I'm gonna go to the hospital right now. I just need my food with me." And sure enough, I ate my food right before I went in that hospital. I sat in that parking lot. I said, "I ain't going in there. No empty stomach. I done worked all day too. Nope, I'm going in there right now." And I went in there. They put the whole cast and everything. Girl, my nails was still up there, the same design, everything. And with the cast on it, I had a red cast because you could pick a color. I was all thrilled with that. So I picked red, and I had that red cast and covering two of my fingers all the way up to my arm. And child, my ex-husband said, "Why did you go get your food first?" I was like, "Because you didn't cook." Look, I ain't playing around. You ain't cook. You and the kids already ate. You didn't cook. But I drove myself right onto the hospital. I got a bad habit of driving myself to the hospital. Maybe it's good, maybe it's bad, but I will take myself to the hospital. Let me feel something that ain't feeling right. I'm out. I'm out. I'm going to the hospital. And they done built 2 hospitals near me now, girl. I ain't got to go nowhere but a mile down the road, and I'm at the hospital. I ain't playing with myself. And when I burst my appendix, here I go waiting 3 days to go to the hospital. Child, that was, I was blessed. That's why I feel like I'm one of his children. I mean, I know I am, but I feel like I'm like extra blessed because he watch out for fools and babies, and I ain't the brightest thing walking. So he definitely watches out for this fool because I ain't been a baby in 100 years since Jesus was a baby. So I already know.
Since Jesus was a baby.
Okay, we was babies together. That's how. That's how long, how old I am. I am old. You know, I have a new admirer, Cosmo. Cosmo is my new admirer. And he talking about, I'm 41. I'm 41. And I'm like, oh God, not another young one. Yeah. No, but okay. We'll play along. We'll play, and I'm gonna send you the picture that made me stop Lovejoy got the one that got the picture that made me stop because I was told I cannot be in For the Love of Anybody because my sixth grade sweetheart reminded me of why I can't be in the any love for anybody's. He said, "Don't make me come up there." I was like, "What?" Let's see. I done started doing it. I done started streaming to Facebook now. That might not have been the smartest thing because he looked at. He was like, "Excuse me, what do you think you're doing?" I'm like, "It's just YouTube." No, it's just YouTube. And look at that girl talking about, "Oh my God," she sent me a thing talking about, "Who is this?" Child, that's my boo. Since the sixth grade, that's my boo. We've been friends for so long. So long. You just wait. You gonna send me a message like, "Girl, you remember that chest I like to show on my thing?"
The good
Okay,
looking
yeah,
one.
yeah, this the owner. This the owner of the chest.
Oh yeah. No, see, don't make him upset. Don't make him
Mm-mm,
upset. He's worth
mm-mm.
he's worth not getting upset.
Exactly. He done already told me, no, you're not doing this. I don't think so. So yeah, no, you're not doing this at all. You check your IG when you get a chance. I'm going to the store so I can start cooking, baby. I love you so very, very
Oh, thank you
much.
too. Thank you for coming. Oh,
Yeah,
girl.
anytime. Okay. Okay.
Oh, girl.
And he sent me a gift right before that with a goat licking his tongue out like, "Ugh." I was like,
You better go
okay.
snatch that up. Just snatch it up. Just
Child,
snatch.
evidently he need a Thanksgiving fix. So yeah, I'm gonna go take care of that. Yeah, no, yeah.
I go take care of that if I was you.
Yeah, I'm gonna go take care of that. That. It's just weird to me. How is you a professional trainer, but you like me? I mean, what? Me, the one who needs to be trained?
He might be able to give you some good training, girl. You
Yeah,
know what I
he gives
mean?
me good training. Very very good
All
training.
that good cardio.
Very good cardio. You cannot tell that thing is the same age as me. Okay. I am not mad at him, so I will not make him mad. That is a boo thing. And yeah, anybody else comes second behind him. He's come first. That's all that is.
He know he
Lovejoy.
number one too.
He
He like,
know he number one. Okay. He is a personal trainer. He know he is number one. And he knows that if he say Lori, I say yes, sir. Yes, papi. See, papi.
I ain't happy.
Papi.
What you want? I give it to you. What time?
Yo quiero tu papi. Mi papi.
You ever like, yes, sir.
Okay. Yeah, when he says move, I say well. Okay, I'm coming. Well, look, might just wind up
You show coming.
okay for a long time. Might just wind up. Let something, God forbid, happen, and I'm by myself. That would be the one that I actually run to. Who will you run to?
It'll show be him, because that's
Yep.
who I'm gonna run to.
Okay, this has known me since the sixth grade, and that we know that was like 200 years ago. I mean, come on.
Not 200 years ago.
200. I'm up there with Puffy and his kneecaps and all them other people in Hollywood that's 150 years old and all that. I listen to Jamil Peterson all the time. He does his Pure Survival series. We are pure survival of Diddy and Gene Deal's kneecaps and Justin Bieber's mom's hair. And he's just a silly. I love a comedian. See, I love me a comedian. Him and a guy named Josh. Hilarious. You need to check them out. But let me go, girl. I ain't gonna never go to the store, and I'm gonna just use it as a reason not to cook. But I love you.
Get your butt to the store. I love
I
you.
know it.
I'm
I
gonna end in a minute anyway.
All right, y'all be good. Have a good Thanksgiving. I'm going live. Just going to the store. We might as well make some
I'll
money
be
while
over
we
there.
go.
I'll be over there. You know I
I
will.
love you. Know what? I love my Charlie. Y'all, but look, Charlie man, better take care of my boo now. Take care of her. Okay, because I wanted to come to Mississippi, come get my boo. I will move next door. Don't play with me, okay? I am officially able to move anywhere in these United States here, maybe for a few states. But, I will take my job with me. So don't make me move on the block, okay? I
Be
will
over here,
move
we
on
be
the
at each
block.
other's houses all the time. Like,
Every day,
where you
all
at?
day.
I'm at Lolo's.
Okay. I had my best friend and I was like that. They moved next door to me and we was best friends for over 20 years. Matter of fact, she and I met when I was pregnant with my older daughter and we became best friends. We was over each other's house next door, back and forth, back and forth, back and forth. We would go, she had a job at the Belos. That was the name of the grocery store. Girl, she told me, bring $10 and come up here. If my whole kitchen won't fill with stuff, she worked at a clothing store. I think it was, remember 16 Plus?
Yeah, I remember that. That was
She
back in
worked
the day.
there one time. She told me, come over there and bring $10. Mm-hmm. I came out there with so many clothes, so many bags of clothes. Back then they weren't doing all that, watching who buying what, when, and where. I had so many clothes. I had onesies. I had all kinds of stuff. I had everything up and out of there. Still got some of the sweaters. I don't get rid of my stuff, child, please. But yes, I'm moving next door to Charlie. We're gonna have the best script club in the South, okay?
What?
Not the strip club, but the script club.
Yeah, the
We're gonna
strip
have the
club
best
on the street
script club.
corner.
Come get your prescription for the script club, okay? That's not a bad idea, neither, Charlie. But anyway, that's a whole nother video. I love you. I'm gone. I see you later,
Love you,
baby.
girl. Bye.
Bye.
I hope that today we had, our contents. We did our content. I didn't do my beef sector recap. Now I did see a question in the chat about how I play this content without getting copyright. I go on the website and play it from the website. Okay, I'm looking up the stuff and I'm using it for educational purposes. You do have to make sure that you put out your your documents that you're doing this for educational purposes, your copyright disclaimer. Also, make sure you get it from the websites. Don't play directly from someone's YouTube channel, even if it is a news source, because sometimes it can strike you through that way, through the automotive service. So, and I do keep getting, other people's content, and I says I can strike it, but I'm obviously not going to, because obviously we're both doing the same thing. They're going to the websites and doing it too. So I'm not going to bother those people, just like they don't bother me, right? We are doing what we do as true crime podcasters. Correct. So therefore I always just, I'm like, ignore that. We're both pulling something from a website and, using information. So that is the way that you have to do it. You have to pretty much use it from the website, show where you're getting your sources and cite them, just like if you were a news reporter, right? And you are reporting on a news situation and you show the real footage. It's the same thing. You are allowed to use other content for news reporting and all that. You just cannot harass nor bully the person who put out the content, right? So there are things that discount fair use. Fair use is not to be used for harassment at bully purposes or anything in the things like that. But you can use fair use using someone else's stuff, as long as you, like, even when I did my Spooky Friday thing, I had used another lady's video to show different places in Mississippi who had been, and I went back as I was going over each one of her stories, and I was showing the true places that it came from and the stories behind it. And so I was using it in fair use because I was taking the content and I was making it my own. That's what fair use is basically for. You're using something and you're expanding upon it, right? You can't just sit there and play the content and be quiet and not commentate or do something, right? Because then you're just basically ripping somebody else's off. But when it comes to court things, right, that's a public, a public thing. So even the people who use it and monetize it, They realized that anybody in the public could get it and use it, right? And when you put anything on the websites, it is for public consumption. Just make sure that you cite your sources so everybody can see where you got it from. Give credit where credit is due. Change and expand the information. Don't just play the and quit. Have yourself up here, talk about your opinions, have your audience interact with it, so it does transform the content. You have to transform it. It's transformative. If you look into the commentary community, it's something they also do. True crime podcasters also do it when we play the court docs and the things and stuff. In news articles, when we play news articles and we're reporting something that happened in our local news area, it's the same thing. You show where it came from, so you're actually giving credit where credit is due. You're also transforming the content into something different. So, in fair use, you're allowed to do that. You're permitted under the Fair Use Act to do that. So you are allowed to transform things. But I want everybody to have an amazing Thanksgiving. I hope you all have an amazing day today. I'm actually going to go over here before we end and see if Lolo is live, because if she is, I'm going to make sure that I drop her link in the chat. I also tell everyone who is all live, when I don't see that, let's see, let me scroll down. Doesn't show me that she's live yet, but she probably will go live in a minute. Right now we have YouTube Cameras is live, Ken Nola, Grown Folks TV, The Good Putty Cat, Miss Verla, from the, over there at the Umar section. Miss Lady Wu is live from the Mo 3 sector. I try to give everybody their shine, because that's just something I do. Now I'm fixing to refresh just to make sure. And let me check my, because sometimes I don't get notifications like I should. So I'm just checking to make sure that those people are actually still live. Now, I believe Ken Nola is playing some stuff from the Good Putty Cat over there in the Mo 3 sector. But y'all keep an eye out for Lolo to go live. She's not live right now. If you would like to, you can head over to YouTube Cameras. She is live right at this moment. Also, to the person who donated to me, I want to thank you. I'm not going to shout out your name because I don't know if that's your real name, and I'm not going to dox you or do anything in that manner, because I don't do that, to someone without their permission. But, I want to say thank you to anybody who's donated. I want to thank the person specifically, but I don't want to say their name. I'm glad you got to decorate them cakes. Now I want to see pictures of them, the hood table. And thank you, D-Ham Show, for the happy Thanksgiving. Thank you all for being here. Like, share, subscribe. You can become a member today. I am fisting this week. We are deciding what movie. So if you're a member and you haven't been on the members Discord, go on over there and say what kind of movie you want to watch this week, because I'm thinking about setting it up for tomorrow, just to let my members know. And I will do a members only live before I start the movie, so that if you don't see the Discord notification, you will know to go over there. But right now I have a poll up asking what kind of movie you would want to watch. So we're going to figure that out, and we're going to test out our very first movie over there on the members only Discord. And I am going to be looking into buying the Jackbox Party Pack, so that we can play some games, and we're fixing to really ramp that up, so that we can all have an amazing time together, and just play some fun games and laugh and hee and ha. So just letting y'all know that if you would like to become a member today, the Discord link is on the members only wall. I will be going live in a members only live soon to repost the Discord link for those who may or may not make it. And for my members who just are supporting me but don't want to necessarily add in on that, or don't want to join the Discord, I totally understand your point of view. Thank you for all your support. Thank you for everybody in the beef sector, everybody in the Mo 3 sector, everybody in the black tea sector, everybody in the black sector, and I'm just trying to make sure I thank everybody who's over here, those who stand alone, I guess we could call y'all nomads, our nomadic people. Thank you. Beef sector, always thank you. That's my home. That's my place. Regardless if I don't beef or do anything, y'all have done nothing but support me, and I try to do nothing but support y'all. I hope everyone has a blessed day today and has amazing food in their belly and stories to tell me tomorrow. We don't know what drama's going to go down today, but we shall see, child. We shall see. Y'all have a blessed one tomorrow on True Crime Thursday. We got some updates on some stories, and we're going to be looking at some new court cases. I am going to show you the update of the guy who I showed last week. He did get, found not guilty. So we're going to watch that. And we got some other things. The sentencing for Sarah Boone is going to be on December the 2nd. It's like 4 days from now. And so when Sarah Boone's sentencing comes out, I will be playing, even if I have to do a extra live. Hold on just a minute, y'all. Sorry, I had to cough. I'm still getting over that cold, so I'm sorry. No. Nobody's watching Cupid. Cupid sucks. No. It's a terrible movie. Okay. Anyway, so we will be watching stuff and doing those things. And I will be going over things tomorrow. So if you want to come back in for the true crime and the fun of the true crime, come back tomorrow. We're going to have a little fun. If you have anything that you would like to talk about on my channel, drop a comment. Let me know. We do have Topic Tuesday, where the subscribers get to choose the topic for Tuesdays. Mondays is always mod and messy. We can be as messy as we want to be on Mondays. And then today is Wellness Wednesday. And this topic, even though it is true crime, did play into wellness. It did play into mental health and those questions we have about things like that. So, it did play into the topic. And Fridays, I'm going to have to change the name of it from Freaky and Friday to maybe something else. But maybe we can keep it freaky. You never know. But y'all have a blessed and beautiful day. And I will see y'all on these streets. I love you, my angels.
I'm from the T-U-P-E-L-O. I'm reppin' my hood, so love I'm gon' show. From the T-U-P-E-L-O. I'm reppin' my hood to the day that I go. From the T-U-P-E-L-O. I'm reppin' my hood, so love I'm gon' show. From the T-U-P-E-L-O. I'm reppin' my hood to the day that I go.
I'm from the west side, we don't need no introduction. This was the best ride. We all big boy rolling and holding. Come take a test drive. Hilldale, Evergreen, Glenkirk, Outer Street, bending every corner on the west, and that's where I'll be. Sunroof back, Captain C banging down 1800, chunking up the deuce to my post slanging down on 1800. Show no love to the ladies that's training round on 1800, making time stand still, crystalline swinging down on 1800. Watching out for them knuckleheads that be staying round on 1800. Big rims and low pros be blanging round on 1800. Better completely change the way you're thinking about round 1800. Really hate to see you boys get left slanking around 1800. Out of street got some history, just let Captain C lay it out. If I don't finish it all on this one, let the second verse play it out. Remember the blue apartments from OG standing back there by 60 deep. Bull walking, car blue, a big Anthony using P.
I'm from the T-U-P-E-L-O. I'm reppin' my